Early Learning Council together to order for Thursday, January 29th. Thank you all so much for being here. We do have a couple of logistical changes to the agenda, which I will go through in just a few minutes. And I know we have a couple of council members who are running late, but who do plan to be here. So, and we will have, excuse me, at least one at least one council member, Bobby Weber, who will be, or excuse me, I'm sorry, Marlene Yeskin, who will be joining us by phone for portions of the meeting. So welcome everyone. We had a fabulous visit here in the Marion County community yesterday. And not all council members were able to join, but many were. And in just a moment, council members will give you the opportunity to offer your reflections and thoughts from that day. But why don't we get started with roll call, Alyssa, and then we'll move on to the announcements in the agenda.
Good morning. Pam Curtis.
Here.
Martha Brooks.
Here.
Tim Freeman.
Present.
Callie Thornlad.
Present.
Charles McGee, not yet. Eva Ripito.
Here.
Krista Rude.
Present.
Lynn Saxton.
Here.
Bobby Weber, not yet. Jim Tierney.
Here.
Terry Tallhofer.
Here.
Kim Williams.
Here.
Dick Withnell.
Here.
And Marlene will be joining us on the phone.
Great, thank you so much. Well, a special welcome to our new council members. We're really pleased that you have been able to join us. And council members, I sent out an email. There will be a press release that will go out this afternoon. But we particularly want to welcome Tim Freeman and Khalil Ladd and Martha Brooks to our group. So thank you so much for being here and for joining us. Let me just talk a little bit about the order of the agenda and how we will plan to do things today, just a scooch different than usual for just mostly logistical reasons. So Megan and I will give our chair and director report following the opportunity for members to reflect on their experiences yesterday. And then we have 3 rules that we've been in the process of promulgating over the last multiple months, and these are in final form. You've seen these and commented on them, but there are 3. One is on the use of medical marijuana in licensed child care, and the other 2 are on registered family home rules and central background registry rules. The latter, the central background registry rules, are largely to make our rules consistent with state statute. And we have had rule committees on each of those. So our practice typically is that when we get to final rule stage, these are on the consent agenda. But because we know we have interest in these, and because we had 2 separate rule committees, we will take them in 2 separate chunks. So we will look at medical marijuana, and then we will look at the child care rules listed as B and C as a separate group together. Because we know we have folks here who may want to comment on them, we will do a bit of public testimony after the chair and director's report before we get to rules, and then the final public testimony and input toward the end of the agenda. So if you're here to comment on any of the rules, I'd ask you to sign the testimony sheet. I'm gonna call final call for just a moment, and we will allow some public testimony before we get to rules. And please, if you do plan to provide public testimony, please keep your testimony to 3 minutes. Okay, so that's how we will plan to do the agenda, and we will take a break at a natural point toward the middle of the agenda. Is there anything, council members, that you know that we need to take on that's not represented on the agenda today? Okay. Well, with that, folks who were present and able to participate in the community conversations yesterday, do you have thoughts or reflections for the meeting today? Things that that really stuck with you that you want to share with your colleagues who were not able to attend? Eva.
I really appreciated the time that we spent with the hub and then the hub board. Is that right? Was it? because I mean that's definitely a good way to check in with what's going on, and then provide to have time with the community too. And I'm wondering if there isn't a way where we could have more meaningful discussions like we did with the hub board and the stakeholders there with other community partners, because we've spent a lot of time with them and that was very valuable. But I think if we could give some more time to the other partners that maybe aren't in that more formal setting, that would be valuable too. And I'm not sure what.
Yeah, we did get a lot of feedback, or some feedback from those of you that participated yesterday. Particularly excited about the conversation with parents. And wanting more of that. And so as we go forward with with our community visits, we will try to structure more of a conversation with parents as opposed to just sort of an input session, which is how last night was structured. So I think there are some thinking already about how we can do that. So thank you.
Put it out there.
Are there others, Kali?
Well, I really enjoyed the parent outreach, the community forum. I was really impressed with the turnout. I thought it was great that there were interpreters and people really had a chance to express their ideas around how we make a quality early learning system throughout the state. Some highlights were around, not losing play and, what do we call quality when we look at teachers, and how do we ensure we have teachers that are able to support children that are qualified. And the role of dads came up, which I was surprised in people talking about just how important dads are to the equation for families. So I thought it was good.
Great, thank you. Yes, Lynn.
I was very excited. First, it was wonderful 1 year later to see the Marion County Hub up and rolling, and with their new unification with Polk County. That's a progress step that should be noted. But most importantly, there was a good discussion of how the collaboration between the CCOs and the Hub and the educators and all the partners in the community have figured out how to connect the what's it called, the ASCU ages and stages to the medical record, which is connecting developmental educational data to medical data, and it's imperfect at this point, but they have done it. So that's kind of like landing on the moon in this work. And we need to really call that out, because they did it and figured it out, not because we told them to. They just figured it out and are in the process of doing it. And that's a landmark. That was very exciting to see and to hear about how they're doing it. So I was thrilled to see that.
You did. So we're going to come to you at the end after others. So Kim?
I
and then
just
Krista.
so appreciated the honesty that we had last night, and I think that I really want to hold that folks were really sharing true feelings and emotions about their work and their perspective, and they were actually sharing them with us. So I just thought that was a very pivotal, not that we haven't had wonderful shares in the past, but I thought that was very pivotal last night, to feel like they felt their voice could be heard and they were willing to share that with us. I was very grateful.
Thank you. Krista.
A couple of things from the meeting with the kindergarten partner in innovation and the family engagement. The first thing I thought was really strategic was the engagement between preschool and childcare and the partnerships around training and support that happened there. Just that it was a really fantastic way to start thinking about how we're having a common discussion about what it means to have quality and to support each other in this important work. And then the other thing I thought was really interesting was we see this again and again, but the conversations that are happening in hubs between early learning and K-3 that are just really moving forward what it means to work together. There were some specific comments around parent engagement, and we heard some of that even last night too, about how we can think about the way to support families both in our stable and attached approaches, but also how that impacts work in elementary schools and what we're learning from both sides of the table. So I just thought that those were boots on the ground, real examples of how that work is emerging, and I found it to be very encouraging.
Great, thank you very much. Great, Tim?
Thank you. I very much agree with the others that commented on the hub meeting and on the community meeting. Earlier in the day, I attended a meeting, some of us did, with the business community, Salem Chamber, and I was really encouraged by a couple things out of that meeting. Number one, they asked how they can help and engage. They asked us that. We didn't tell them they needed to do it, which was really exciting. And I think they're genuine about wanting to understand and become a part of the solution. So that was encouraging for me.
Yes, Terry.
I agree with Tim. The one comment that was made at the Chamber of Commerce meeting that has really stuck with me, I don't consider myself old, but I guess I'm going to have to move in that direction, was when he said that he had heard that millennials don't seek out information, that if something is important enough, it will find them. I find that a little bit horrifying, but I think that really needs to frame, we really need to consider that when we frame how we reach families.
So I want to just add to that, I attended the chamber meeting. That was the first meeting that I attended in our visits, and then the last one last night in the community forum. And I actually heard some consistency between what the business community said and what the parents in that meeting last night said, which I'm really simplifying, and I'm not doing either set of conversations justice. But the business folks who we visited with really encouraged us to figure out how to get directly to parents, not through service providers, but just directly to parents. And that's essentially what the parents were talking about at one level last night as well. We tend to think of getting to families through providers and through services, and that's important. But at both the beginning and the end conversation, at least that I participated in yesterday, that was a really strong message, I thought. So, Eva, did you have something else that you wanted to add?
Yeah, thank you. It was Callie, is that I was saying right? Callie, sorry. Said, you know, the fathers came up, and that triggered my thought was we also need to encourage and recruit men to be in the early learning field. And I think, you know, traditionally they haven't been there, and we should make that a focus too.
Great.
And I've heard that consistently throughout. And then just I would like to also say that when we're thinking about business leaders, childcare providers are also businesses, and you know, at risk of putting words in Representative Hack's mouth, she brought that up consistently yesterday in one of the meetings that we had. She's like, we have to remember that they're a small business too, and we have to make incentives. So I just thought I'd tie that in.
Great,
So
thank
thanks
you.
for letting me speak twice.
Yeah, absolutely. I just want to make sure that everybody who had a chance, who wanted to, had a chance to share reflections. Is there anyone else who has reflections from yesterday they wanted to share? Okay, well, yes, Martha, and then Dick.
Well, I could. I too was at the business meeting, and I found it interesting, as you said, Pam, that there are connections in that the parents need a lot of supports. And what I took away from last night's meeting, which I really appreciate for the interpretation, and I think that's a pretty critical piece to continue, but that they said we don't have the way to get the information, and it struck me that they were asking for at least a once-a-month meeting or some way to come together and figure out the system and how to communicate and how to make it better for their kids. And that to me was pretty important to hear from them.
I was thankful that the local hub folks were there to hear that as well. Dick?
Well, first of all, I need to apologize to you, Chair. This is not my community, but I've been here for 45 years or so, and I was MIA. I was came in from overseas. But your comment on the business community getting involved in the Early Learning Council, the person who pioneered that was Dick Alexander, and he really arrived at the return on investment on what it's all about on starting at a young age, and I think that's I think it's very important for us to communicate with the business community to show and explain to them what the return on investment is to the business community themselves, as well as the whole livability of the community. It can become, or ELC can become, it's a cliche and everybody uses it nowadays, but it is the high tide that raises all boats.
Great, thank you. All right, any final comments before we move on with the agenda? Okay, and I do want to call last call for this moment anyway on public testimony. So Alicia, if I could, or Alyssa, excuse me, if I could ask you to grab that. And then there'll be opportunity for public testimony later in the meeting, but we'll work with what we've got in just a few minutes. I'm up first for a chair's report, just a couple of kind of orientation pieces. New council members, you'll find at your binder, just kind of to orient you because we didn't talk about this yesterday, there's a binder at your desk at your place, and it will be here every time you come. Essentially starting with tab 2 and behind that, they correspond with the items on your agenda, basically, is how to look at that. And then there are some resource materials that always stay in your binder. You're welcome to take the meeting materials from today with you, but there are some historical documents that we've asked to have here, and those are intended to stay, and then your binder gets reused at the next meeting. So that's the practice of how we've used these. In terms of
Do we leave our binder here at the end of the meeting?
Yes, thank
so then
you.
it'll just keep reappearing.
Take what you want from the meeting
Got
today,
it.
leave the binder. There's historical documents in the binder, just magically reappear thanks to the staff at every meeting with new, fresh meeting materials for the next meeting.
Thank you.
So a couple of items of announcement from my perspective. Also for new members, we have a pass-around folder. It's always red, and there are some things that both Megan and I will reference in this. It's just designed to pass around to give you some additional information, and in this case, we have lots of activity-oriented items in the pass-around folder. So one item that you'll find is a card. Some of you may know that Duke Shepard, who was our contact in the governor's office for our work, has left the governor's office.
You stole him, right?
Well, he decided to say that.
It's a draft.
Yeah. I'll just say that I got a one-word voicemail from a prominent elected official. So we have a nice little card for Duke, and we have a plaque for him. He was not able to join us today, and so
Must have a tough boss.
Because he's working.
yes, somebody has to work. So he's not able to be with us today, but we do have a plaque that I will take with him, or to him, and then there's a card if you would please sign it. We are expecting Dana Harganani to join us today, and so we'll do this officially when she comes. But I just wanted to announce to members that Dana will be moving on. Dana filled a slot on the Council for the Oregon Health Authority, and our own Lynn Saxton is now the director of the Health Authority, so she will fill that slot, and Dana will be moving off. So we also have a nice plaque for Dana when she comes, and we'll have an opportunity to talk with her directly. So hopefully she will be here as planned, but just to give you a heads up about that. Also in your folder, we are trying to schedule, in conjunction with legislative staff, a legislative orientation and update to the work that we've been doing. You might remember we did this 2 years ago when we were just getting started, and it was very popular, and we've been asked to do that again. So we've narrowed some dates and working with legislative calendars, and if you could just indicate your availability for the dates, they're in the red folder, it would help us to know dates when you could come to Salem for a breakfast, and it's really an update and an orientation about the work that we've been about over the last couple of years. Also in the folder, related to legislators, we're asking all of you to be in contact with your representatives about the work that we're doing. It'll help the legislative breakfast orientation go a lot smoother. And so the staff has created a nice little grid based on districts. If you could just indicate which members you have relationships with and or are able to contact in advance of the legislative breakfast, that would just help us with some of our organizing, and then we'll ask you to do that. So talking points will be forthcoming. If you need help organizing conversations or meetings, please contact Megan. But initially, if you could just indicate which members you'll be talking with, and then we'll get you all of the materials necessary to do that. So all of that is in the pass-around folder, and it will be coming your way in just a few minutes. And then lastly, I think on my list is to remind you all that as we've inherited all of these various and disparate programs that we've inherited under the umbrella of the Early Learning Council, we are inheriting existing programs, some of which have been in existence for 20 or 30 years, and some of which have not been rebid for that amount of time and are due. And so the first one up is Healthy Families Oregon. Martha has been chairing the advisory board for Healthy Families Oregon. And so we will be letting an RFP to recompete that program. That's the first up in our queue. Others will be forthcoming over the next couple of years. And our process is this. We have folks from the Healthy Families Steering Committee and others who will be willing to serve as raters and evaluators of applications. If members of the council would like to do that, please let Megan or myself know so that we can get you in the queue for rating, much as we did. We'll structure it much as we did for the hubs. Only rather than have a separate award committee as we've done for the hubs, the executive committee will act as the award committee, and the council can expect final recommendations in May. So that's forthcoming, and I wanted everybody to be aware of that. Questions or comments from my report, council members? Lynn?
I do think it's, and I'm sorry Duke can't be here today, I do think it's important to acknowledge that Duke is one of the people who, through his work from the inception of this effort, his very quiet, very no drama, very direct, efficient, considerate but firm leadership in the process has gotten us where we are today. We would not be able to be as far as we are without his professionalism and his intelligence. So I just want to thank Duke for really pivotal work behind the scenes and really an impressive public servant in his efforts on behalf of children.
Yes, you're here. Other comments or questions? Okay, I think we're on to the director's report.
Great, thank you. And since we have such a full agenda today, I really just have a couple of quick housekeeping items for council members. Number one, if you're one of our council members that needed to travel to be here and needs to be reimbursed, Alyssa will be emailing you the forms to get that taken care of. And then number two, there's just been an addition to your packets this morning. As we've been going through the process of promulgating the medical marijuana rules, this council directed us to ensure that they addressed the ballot measure that passed in November. At your direction, we did that, and you reviewed our rules related to that in November. In the packet that we sent out to you, we sent you rules that were one set out of date. So the ones that you have here in front of you that say updated reflect the fact that the ballot measure passed and we need to regulate recreational use in child care facilities as well. So just a housekeeping update. You've seen these before, seen them in November, but wanted to make sure that you knew that. With that, I think I'm going to let the meeting go forward since we have a packed agenda and not a lot of time.
Okay, thank you. So we're going to move to public testimony. We have two signed up at this point for public testimony. We're going to ask you to hold your comments to about 3 minutes and to come to the desk to give your comments, and then we will move on to rules. And again, there will be, I'll put this back out on the table, and there will be an opportunity for public testimony at the end of the meeting as well. So I'm just going to go in the order that we have folks signed up. So we have David, and I can't read your last name, and I'm really sorry, from AFSCME. Is it Autumn? Oh, Autumn. I went the other way. I'm so sorry. You're one of those fortunate people that gets two first names for your name. So please join us. And
so I'm Autumn David from AFSCME. I'm the president, and I'm also a certified family child care for 16 here in Salem and a 5-star quality rating program. So just a couple things, the concerns for, is this the right time for the rules?
It is.
Like, okay.
This is it.
So just for the 15 passenger vans, I just want to let everybody know it's a big concern for a lot of the providers. Myself, I own one. We transport between 6 to 8 different schools in the morning, and throughout the day, about 10 schools. If those were taken away from us, I have a full-time van driver that gets my kids to school. My longest child that's been in my program has been 11 years, and that's because they came as a 18-month-old all the way through school, and I was able to transport them. Without the van, we can't do that. The stability of the children are hugely important to the families and to us. So I'm just speaking on the 15-passenger van. I really hope that you guys don't move that forward. Another thing is visitors. With the criminal background registry, we need a definition of visitors. There's a length of time for visitors. There's no definition of how long a person is in your home or how frequent. What is a frequent visitor? There's no definition. For me, I have my son just graduated college. Sometimes his friends will come and stay the night with him. I have so many people linked to my criminal background. If I had a fingerprint, I have over 30 people linked to my criminal background because I run 2 homes and I want to make sure I'm in compliance with all that. If I had to go to fingerprinting and the expense for me to fingerprint all those people, what is a frequent visitor? Nobody can answer that for me. Another thing, I went to the community forum last night. Thank you for having that. I just want to be mindful of, I think there's 2 different things, one for parents and one for providers. We really need to look at having 2 different maybe forums because providers have a lot of things to say and an hour is not enough time, but thank you very much for having that. I know we got a lot of feedback from parents. Also another thing, one more thing is having, I spoke to it last night, is making sure that family child care is represented on some of the committees that the Early Learning Council has. I know we have Eva, and we feed a lot of things through Eva, and I'm grateful that she's on the Early Learning Council, but just on the committees to be mindful that no family child care. I know we have one center on the child care committee, but no family child care is represented in any of the committees. And the last thing I have is that in the rules that are going to be proposed about I know one, it's on page 25 for the alcohol, but the wording, I'm just mindful of while you're doing child care business, so like it's saying family child care home during the hours of child care business is conducted or when child care children are present. If you have a barbecue, if you're closed on the weekend and you have a barbecue, many of your families become involved in your own family. You have a community, and so they may be invited to a barbecue on the weekend. My house, I don't allow alcohol. That's just my own personal choice between my husband and I. But for other providers, if you're having alcohol or that's just one example, but that wording in there, my license is opened. I'm open 24 hours, but I do close. If I don't have kids, I'm closed, but my license still reflects that I'm open. Somehow that wording needs to have more talk, and I think that if you're having a barbecue on the weekend and you have childcare present because they're family, does that am I making sense on that? So childcare present, they can be there at a family barbecue. So dad may be drinking alcohol. I'm out of compliance.
So we need you to wrap up.
Okay, and so that's just, those are the main highlights of what I have to say.
Thank you. Great.
Thank you.
Congratulations
so much.
on your 5-star.
Thank you.
Later on?
Yeah, we'll do it later.
Okay.
All right, and then next on our list, excuse me, is Anthony Taylor from Compassionate Oregon.
Well, thank you, Madam Chairman and members of the council for allowing us time to have at least one closing argument here on these rules. For the record, my name is Anthony Taylor, and I'm the director of Compassionate Oregon, Oregon's only patient advocacy group for medical marijuana patients and their families. I've participated in trying to hammer out some reasonable rules for this particular situation. And as my mom once said, she's talked till she's blue in the face. And without much success, I would congratulate the council on a couple items. One is allowing the administration of medical marijuana to pediatric patients while in daycare, and also to kind of rolling it back and allowing non-providers with medical marijuana cards to at least use it in their own home after hours. But there's several contradictions. One is that you've consistently said that you have no jurisdiction over the adults/parents that are dropping off and picking up children, yet your definitions of premises and under the influence, if strictly interpreted, could mean that parents that have a medical marijuana card and could really be assumed to be under the influence at any given time, no longer allowed to be on the premises or have contact with child care children. The other thing you've done is you've added the July 1st criteria in the new rules. So after July 1st, a daycare provider can consume all the marijuana they want to after hours and can keep all the marijuana on the premises that's legally allowed under law. Yet if they have a medical marijuana card, they can't be a provider. We find that highly contradictory and would really encourage the council to reconsider that. The other thing is, over the years in Oregon, I've heard, I've been to many meetings and heard the term evidence-based policy. You've thrown that out the window in 414-300-0070, where you say that there is no longer a requirement that questions about providers' competency are evidence-based. You've removed that and said that if it's additional information is needed to assess a person's ability, so now you don't need a reason to search for other information. I know I have just a short amount of time. I'd also like to comment on the inaccessibility of council members. There's no way to get a hold of you folks. I can't send you an email directly. At least in the times that I've tried, I have not been able to accomplish that. So
wrap up, Mr. Taylor.
You know, you guys have, in Michelle Alexander's book, The New Jim Crow, she talks about discrimination and discriminatory policies. She makes a comment that if a person's being exploited, it means that they still have some value. But when they're marginalized, it means they have no longer any value and they will just eventually drop off the radar. That's what's going on with the discrimination against medical marijuana card holders from being providers. You wouldn't do this to the gay community, and you certainly wouldn't do it to the black community. And I really would ask the council to consider that dynamic in proceeding with these rules. So I guess in the final analysis, no one, not the Department of Ed, not the AG's office, not this council, has sufficiently justified why Oregonians that use medical marijuana under a state program, even in light of evidence of the Office of Child Care memo saying that it's totally legal, you've singled out this community and prohibited them from attaining a license based solely on their possession of a medical marijuana card, whether they use it or not.
Thumbs up, Mr. Taylor. Can
All right, so, and in conclusion, I'd just like to encourage the council to let these temporary rules expire and go back to the policy that existed before this isolated yet much publicized incident, and allow medical marijuana card holders to become part of this, remain part of this community. Thanks.
Thank you very much.
Any questions? I'm happy to answer.
All right, thank you very much. We're going to move to consideration of the rules then, council members, and as I indicated earlier, we are first going to take the medical marijuana rules up under consideration, and then we will take the registered family home rules and the central background rules together. And so I'd like to ask Cindy Hunt to come up. Cindy, for council members who are new, Cindy's legal counsel and has been working with us and the 20 or 25 person committee that we had helping us to draft the rules. So Cindy, can I ask you to give, for the benefit of new council members, can you give us just a quick timeline sketch of what we've done, and then just very briefly summarize what we have in front of us.
Thank you, Chair Curtis. As she was saying, I'm the Government Legal Affairs Manager for the Oregon Department of Education, in which the Early Learning Division is a part of. And so it's my pleasure to appear in front of you for the third time, actually, on these rules. So where this started, as Mr. Taylor alluded to, was there was an incident last summer, and that caused us to bring temporary rules in front of the council at August 6th in a pretty fast kind of manner. And at that time, the council heard a lot of public comments from various people. They adopted the temporary rules, and so the thing with temporary rules, they only last for 6 months. So that adoption expires on February 3rd. And they also, though, at that time, or I should say you, directed us to go forth and do a more complete process. And what you meant by that is, hold work group meetings, collect public comments, basically allow more time and research, around these rules. Also, the process also sort of, straddled the adoption of the ballot measure. And so there was a lot more discussion just as a state around marijuana generally, and that also helped to inform the development of the rules. So what we did was we did research other states. And, in Oregon's, especially with the ballot measure, a little cutting edge on that. We also formed an advisory group, and I'm so happy to see several of our advisory group members in attendance today. Eva participated, I know, Mr. Taylor, who you just heard from, and there's several other of the folks in the back of the room, too. And that just shows the dedication and the care that was given to this topic, that our advisory group was engaged and continues to be engaged. And we didn't pick folks that would all agree with each other. The best advisory groups, frankly, are robust and they debate, and that's what creates the best product, and that's certainly what we had. And then we also had 2 hearings in Portland and Eugene, and put the rules out on our webpage and sent them to folks like legislators and our stakeholder list, and pretty much anyone who would receive them. Went out to probably thousands of people and collected comments. The summaries of those comments and some of the issues that came up is in your packet. It was in your packet in November, and it's also in the updated packet that Megan drew your attention to. So then the ballot measure passed, of course, and so we looked at that. And so then in November, we presented the rules to you, and those rules in November incorporated in aspects of the ballot measure at that time, okay? And the main provisions of the ballot measure that are relevant for this discussion go into effect July 1, 2015. So you will see in the rules, beginning July 1, 2015, yeah, that's why. So in the substance, the rules affect registered family child care homes, certified family child care homes, and then certified child care centers. So as you go through them, it looks like a little bit repetitive, but the reason is it's affecting all of these different centers. At a high-level summary, what the rules do is they do say that a provider who holds a medical marijuana card for growing marijuana or to be a distributor of marijuana cannot be a child care provider. Now, one of the issues that keeps coming up is that the Oregon Health Authority, who manages the medical marijuana program, keeps those cardholder names confidential, and we do not have special access under these rules to that list. We do not have special access to their doctors. That nothing, that's in law now changes with this rule. So no one's privacy, if you will, is being violated. We also prohibited no growing or distributing of marijuana, specifically on the premises. That's something I think that the work group felt very strongly about. Yeah, exactly. And then and then we prohibited adults specifically from using marijuana on the premises during childcare hours or when children are present. And that was any marijuana, not just medical marijuana, but any marijuana, right? And then no adult should be under the influence of marijuana and have contact with childcare children. And then all medical marijuana must be kept in its original container if purchased from a dispensary and stored under lock, even if it's not purchased from a dispensary. And that was something that we added to the rules as a result of our work group and our work group members talking about kind of what the product looked like. And then the derivatives and the paraphernalia also stored under lock, and and then child care providers must allow inspection of all areas of the facility that are accessible to child care children, and a health and safety review of other areas. We also prohibited smoking e-cigarette and vaporizers, smokeless tobacco. So there's a little bit on some stuff that's not quite medical marijuana in there. That's also kind of a cutting edge topic, in the state, how to treat vaporizers. So we've addressed that. And then also no alcohol during childcare hours or when children are present, no one under the influence. So the treatment of marijuana and alcohol are very similar in these rules. So with that, let's see. So with that, we're asking for you to adopt the rules today. And I'm open to questions.
Thank you. Let's see if we have a motion to adopt the rules, and then we'll open for discussion. Do we have a motion to adopt the rules permanently?
I so move.
Thank you, Kim. Is there a second? Thank you, Terry. So, council members, discussion or questions? Martha?
Chair, I do have a couple of questions, and not having been in on the first part of this, and I just need clarification. When you discuss under influence, I know the influence is quite different for alcohol versus marijuana. So when you say not under the influence, what are we saying? Is that immediate influence? Is that 30 days later?
Yeah.
Because it's the blood level is quite
Right.
different.
And that was one of the things, thank you for that question. That was one of the things that the work group discussed a lot, is that because with alcohol, because alcohol has been legal for a lot longer than marijuana, there are various blood tests and so forth that you can take, and there we have very, tight legal standards, 0.08 and so forth, your blood alcohol. But with marijuana, it's not as clear. And the reason I say that is, for example, marijuana can stay in your blood a period of time, but yet you would not appear to be under the influence. Okay, so we talked a bit about what would that look like, and we did come up with sort of a list of things, but we chose not to draw like a bright line, because I think the other thing that everyone in the work group agreed to is that we did not want, for example, the Office of Child Care staff taking blood tests, for example, of folks to determine, under the influence. That was not a place we wanted to go down. So it's not 30 days. There's not like, a disclosure that, if you have ingested or smoked marijuana, then, you can't be, for 30 days. It's more, I think, an observation by child care staff and by, complaints that would be filed against the child care facility.
Other, comments or questions, council members? Eva?
So, I'm looking at, and I know that it was an error, but I'm looking at what we were given via email versus what we're voting on today. And even the format and everything is different, so it's kind of hard to look at where we've been. Like in the September draft, the only definition we have is premises. And then, in the November draft, we have all of the definitions. So, I'm just trying to think about where we've been and how we got here. And, so it makes it hard for me to
that was
process.
Unfortunate. So it was a staff error.
Right.
What you have in front of you is what you had in November. They just
Right.
accidentally sent the wrong version in the email.
And so, but, and I'm, as I was going through, I wanted to compare, and that's how I found out that, like, oh wait,
we're looking at the wrong thing.
Yeah because I remembered some things changing from September to November too, so I think that makes it difficult to process. I do have some issues still with kind of what Mr. Taylor was saying. Here we've created this, you as a provider can't have a medical marijuana card, and you've been prescribed this by a medical professional, and you could be prescribed other pain medications that could even impair you more than marijuana. And I understand it's a tough place because it isn't as regulated. It isn't, there aren't like you take 5 milligrams or whatever. I just have a concern that we're telling providers you can't have this prescribed medicine, but come July 1st you treat it like alcohol, and that's okay. So the person who has presumably a legitimate reason to use marijuana for medical reasons is being told no, but because of a ballot measure that passed, we're saying, yeah, you can use it July 1st recreationally during non-child care hours. There just seems to be a disconnect. And, there seems to be a disconnect that, are we going to start saying to child care providers, we just don't trust that you know how to use your prescribed medicines, pain relievers, whatever it is. There are a variety of things. And I know I talked about this at the Rules Advisory Committee. For people who have seizures, the medication is so toxic that there's a timer on the lid. And there are strains of marijuana that are lower in the THC that people are using and that have been effective in keeping the seizures at bay. So I just think that this is kind of, we're making this blanket rule of saying you can't use this prescribed medicine because we had one person break the law. And I just find it troubling. And then, the definition of premises, I still, I should have said, starting off, that I appreciate the movement that has happened and that the conversation and everything. It's because I don't want to not acknowledge that. I think it's been good. There has been a lot of listening. I'm still concerned that for providers that are opening their homes, and I know again that this is a really delicate balance because ultimately we're responsible for the safety of children, but providers are sharing their homes with people. And so what does a health and safety inspection look like? Is it opening the door to a room and just looking to see if things are okay? Is it going through somebody's drawers to see what, and I think that providers have some concerns about what we've written and what it means. And then additionally, as Autumn brought up, the during childcare hours or when childcare children are present. I know during the Rules Advisory Committee, I asked, can they hang a sign that says closed, and I know a lot of providers do post their hours, a month in advance saying I will be closed these times, but does that count, and we never made that clear in the rules. So I have some concerns.
You're still struggling.
Yeah.
Tim.
Great, and thank you for your comments. I just want to make sure I understand something clearly. In my previous role, I spent quite a bit of time around the medical marijuana program, and it's my understanding that doctors don't prescribe marijuana. They issue a medical marijuana card, which is far different than prescribing medicine. There's no dosage amount, there's no specific use or when and how much, so I just want to make that distinction.
Thank you.
Eva, this may help you. I do have, in case anyone else kind of noticed the difference between the packet that was sent out and then the packet from November and, the more updated. There's essentially 5 differences in the rules. So the differences is that we distinguish between growing, distributing, and users. The original temp rules, we really were really focusing on users, and then we went, oh my gosh, there's distribution and growing. The second one is that we distinguish between children and adults. We've talked about how children who have cards can continue to come to child care facilities. The third was that a relative who has a card can continue to have the card, but they have to medicate off-site. In the temp rules, we didn't really allow for that, so that's a difference. Fourth, the storage. We talk about the storage specifically of the marijuana having to be under lock. And then finally, there's some ballot measure specific provisions that I talked about that address, all marijuana versus just medical marijuana. So that's the 5 big differences between what was in September in your original packet and then in November and what's being voted on today. So hopefully that helps you.
Further discussion, council members? Jim?
I want to ground this in my world, which is anti-poverty. I want to thank Eva for her comments. I think she's right on in her concerns. And it's not easy to talk about this subject. And I think that, as usual, Eva shows a level of courage that makes me very impressed. Let me say that, from my perspective, people are child care providers in their homes, oftentimes because that's one of the things they're doing to try and make ends meet. If you're a person that one of your options, one of your remaining options is to do daycare in your home and you are using medical marijuana to manage chemotherapy or whatever the other reasons are for that, I think we're cutting against our very own mission here. A big part of what early learning is, in my opinion, is about anti-poverty work. And so we're sort of cutting against our own mission, in my opinion, by being unnecessarily restrictive. And I do think a inconsistency between our two stands on this, and it feels political to me. And unfortunately, the people who are going to be the recipients of that political decision are poor. And I'm not necessarily trying to stand in the way of moving the rule. I know we need to do that. We are at the last minute. Seems to be what happens a lot here, not at DLC, but in Salem in general. But it would be nice for us to, at least at minimum, agree to revisit the marijuana card issue and not adopt a rule that will get left the same for 5 years. I do think there's a reaction here to the one event, and it's unreasonable. So that's just my feeling.
What was the rationale behind the medical marijuana versus recreational? Why?
Mm-hmm. Yeah, there was, I think, I can let Megan speak to that a little bit, but there was a couple of reasons. Originally, it was very much medical marijuana focused because that was the incident the ballot measure hadn't gone through. So I don't know if I call it regular marijuana, it just kind of wasn't on the table, so that was part of it. There's some differences. A medical marijuana card holder can have more marijuana in possession than under the ballot measure. Also under the ballot measure, if you're over the age of 21 only, you have legal marijuana. With medical marijuana card holders, you can be under the age of 21. So there's some differences there. And anyway, I'll let Megan, if you have anything to add.
I can share briefly. The crux of the issue actually gets to what Tim surfaced, which is that for marijuana, there's no prescribable dose. And so the only way that we can find to regulate use during childcare hours or when childcare children are present with medical marijuana is to prohibit the use of the card so that there's no gray area around whether or not you can or cannot be medicated while other people's children are in your care. That was the way that we thought about it. And Cindy, feel free to chime in with more official legal language, but the crux of the issue is what Tim surfaced.
And, and some of the questions that you're raising or that are surfacing a little bit, the legislature is going to be wrestling with. They have specifically appointed a committee to deal with marijuana issues that includes members of the House and the Senate. There's several bills in, around the larger issue of, the medical marijuana program versus the other program under the ballot measure. So I anticipate that there will be some sort of legislation coming out of there that may impact this rule and that we will be revisiting this next summer or into the fall because of our friends in the legislature.
Bobby?
The other thing that I want to say in terms of revision, that's in our hands. We now are the rule makers for child care rules, and we have the work group working carefully through a sequence, and at any point we can say we want any set of the child care rules reviewed, and that will start a process. And so I just we don't have to, we're not putting anything in stone. We're in control of the rules. Not that it's an easy job, but we're not in any way handing that off to anybody because it comes here.
Yeah, thank you, Bobby. I had myself in the queue to speak, and I'll do that now. I mean, I think I wanted to say a version of what both Cindy and Bobby said, which is this is a difficult issue, and it's an issue, a public policy issue that I think Oregon and Oregonians are not finished with yet. I would be surprised if this is the last time we have this conversation, but we need to have this conversation at this point in time with the information that we have at this point in time. There will be lots to come. We'll have regulation of recreational marijuana. We'll have the legislature putting some parameters around that. We don't know what those will be. I'm quite confident the issue will be back before us probably sooner rather than later to attempt to be consistent with those steps, whatever they might be. We can't predict what they might be, we just don't know. So for now, what the rules do, and I'm quite comfortable with it, is that they make consistent medical marijuana and recreational marijuana with other substances in the child care rules, alcohol, and in schools, alcohol and tobacco. We are consistent with what our school policies are in these rules. We are consistent with what how alcohol and tobacco have been treated in these rules. And we are essentially putting, saying that the public, when made to choose, we are putting the policy in the choice of health and safety of our children. We understand what that means, and it makes it really difficult for, I think, a small handful of providers. And that's a difficult place to be. But for me, on balance, I balance on the safety side. And we are consistent. If we were inconsistent, I would be concerned. Other council members? Okay, I'd like to call the question. Council members, we will do a voice vote and rather than a roll call vote, since we did that previously on the temporary rules. So the motion on the floor is to adopt the medical marijuana rules into permanent statute or permanent into permanency, and I think we have clearly understood by our conversation that we will be revisiting these at some yet to be determined point in the future. All those in favor of the motion, please say aye. 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 Any opposed? So let the record show that Eva is voting no. Are there any abstentions? Okay. The medical marijuana rules are permanent. Thank you very much. Council members, we're going to next take on the two child care rules in front of you, which are registered family home rules and the central background registry rules. Again, I'm going to ask Bobby, who has been chairing the rule committee on this, to briefly review what is before us, but I want to remind council members that like the medical marijuana rules, these have been before you in the past. We've had multiple opportunities to discuss this. We have a rule committee that's been appointed and has been actively working on these. And so we enacted temporary rules. We asked for some revisions to be made to those temporary rules. Those revisions have been made and are now before you for permanent adoption. So Bobby, can I ask you to summarize what we have and why we have it in the two?
Family child care rules had just not been revised for some period of time, and so the child care division, when it was under the employment department, actually started the process over 2 years ago of gathering input on how, what changes to make in the rules, and it had been quite a lengthy process. But I think what's important is the process includes the input done through forum groups that are done in different parts of the state, where people are invited to come and give input, wide open input on what's in the rules and possible revisions. And then there's some online comment. So that process went on for over 2 years. And then we, the council, got the responsibility for doing rule revisions. So in that process, then we had to do some adaptations, and what the Child Care and Education Work Group from then on acted as the Child Care Rules Advisory Committee. And then we went through another process of input in which the members of our group discussed the proposed, by this time there were proposed revisions, and these meetings are open to the public, so we also got comment from the public. And then have the staff then, if you remember, we brought recommendations to this group from the Rule Advisory Committee. Those were discussed at our meeting. They were then, the staff went back then and incorporated those changes into the revisions that are in front of you. I think, beyond a shadow of a doubt, the most challenging issue in the rule revision is the 15-person van. question, which we discussed at length in front of the council, so I don't know how much we want to talk about it again, except that we're weighing, on the one hand, the very documented safety issues of what happens to children transported in 15-person vans, and the very, very firm recommendations from the federal government that children not ever be transported in 15-person vans, and the hardship this presents for a population, both children and parent and providers, of having to move to get rid of vans that have no commercial value now. I should bring Dick in, but a 15-person van is not an attractive vehicle, and because it's very unsafe, and so and replace it. So either with have to drive more smaller vans, or more likely go into one of the, such as Head Start has done, into the one that are approved. So there was a lot of discussion, with some of us feeling it has to be done and it has to be done now. How can we carry out our responsibility, saying it's okay for children to be transported in a vehicle that we know is unsafe? And the compromise that's in these rules is they're given 3 years. It does not go into effect until 2018. That's the most controversial piece in the rule revisions, and I don't think there's anything in here that we have not already, that would be at all controversial that we haven't already discussed.
So I will say, Bobby, before you arrived, we had testimony about fingerprinting, and just for the record, because it wasn't said at that time, we really don't have a choice. The Oregon legislature acted on this, so this is making our rules consistent with statute. So
that'll come up in the CCDF presentation.
Okay.
Yeah, that we just don't have a choice on that.
So, council members, do we have a motion to approve the 2 child care sets of rules, and then we'll open for conversation?
So moved.
Second.
Thank you. It was Terry and then Jim. And so, discussion, please. Lynn.
So I appreciate the clarification on the 15-person vans. When we heard the testimony last night, I had made a note and to go online, because nonprofits who serve children we had to transfer all of our travel, doctor's appointments, recreation, etc., to smaller vans several years ago by a rule. And so there's probably an alignment here with rules that have been in place with DHS and AMH previously, but and I know that is like really hard. I mean, we have all the parameters that have been raised by the child care providers, and we have staffing ratios that are in federal statute to balance with that as well. So I understand how hard that is. However, given that we have 3 days to make that transition, 3 years, 3 days, 3 years. I think that's. I appreciate that, and I just wanted to say that I think a large part of the provider community had to do that several years ago, is my recollection.
Thank you. Dick.
Just to say that the manufacturers aren't manufacturing the vans anymore, and of course, additional 3 years will make the vehicle probably 18 to 20 years old. So it's going to diminish. Most relief nurseries, as you mentioned, Lynn, all went down to the caravan-sized vehicle or the cubes, and that's which is the safety is not only for the early childhood individuals, but all the colleges and the faith community that was using the 15-passenger vans. There's so much litigation against the accidents there is incredible, because hardly anyone uses seat belts and all that stuff. So they're not being made anymore at all.
Yes, Eva, and then Cully.
As as with a lot of everything we're discussing today, it's been a struggle for me because I do understand the transport issue and appreciate what the providers do. I also know that some of the suggestions, like the transport buses that I guess I call them like the shuttle buses, like you use at the airport parking or whatever, they're too large for parking on the street in a lot of communities. The streets are too narrow, and so like that's not an option, and buying a vehicle like that is not an option. I know that there are retrofits, and I don't know what we can do as a body, or if the state can help, if there's a way to help get the providers resources to get the retrofits, because a lot of them do, I guess paycheck to paycheck, but it's kind of hard to even say it in that way. They're making ends meet, and they have, they're small businesses that are getting by with what they have. And so how can we help them through the process over the next 3 years making this transition?
So I appreciate Eva's comments, and I struggle with this one a bit too. In my work with family-based providers, a lot of them do use vans, sometimes 15-person vans, because they're going to different schools to provide before and after care. My own organization partners with a family care provider to provide before school care, and several of them, they're small businesses, many of them are minority-owned businesses, and they are trying to make ends meet as a small business. So the fiscal impact of this van switch, I think, is tough. And I too wonder how we might be able to support these small businesses in the transition of vans. I feel, being new to the council, I have not seen all of the data on the safety issue. So the childcare providers I know of do use seatbelts and do, strap kids in and make sure that they're safe. So
because the seats can't fit next to each other.
Yeah, so I struggle because I don't have all this data around the lack of safety, and I know for a fact that those vans are instrumental to the small businesses. So I hope that we can think about how we support these businesses with any transition and ensure that they stay stable. Part of it is too how many kids they serve, and do they have the capacity to make several trips. I mean, there's a lot that goes into this transportation issue. So
I would, just having gone through this myself, I think we had to do it 5 or 6 years ago. We were successful in getting private, because this is a safety issue for children. We funded our transition away from our 15-person vans through grants from private foundations in Oregon. And then the Small Business Administration and has used to, I don't know if today they do, used to have loan funds for both minority-owned, women-owned, and small businesses who are making transitions that are driven by best business practices. So those would be the two avenues. Our transition was funded entirely by private contributions. There was no reimbursement for the transition.
Would we have the capacity to support people somehow through this transition, or is this something?
I think what we have since our resources are legislatively directed, I think what we have the capacity to do is to provide some of the kinds of tools and suggestions that Lynn has offered, and perhaps others that we aren't thinking of just on the spot here today. But I think we have the capacity to provide that kind of resource and support.
I can mention that the liability insurance is significantly less, too. You have a 15-passenger van and have liability insurance on that. It's very high.
Staff tried to determine if we could get a measure of the size of this problem, how many people have vans, how many of those are 15-passenger vans, and there's just no data source. And so we've got all the anecdotal evidence from people who are going to have a very hard time, but we don't know how big a group they are, or what percent of the family child care providers that are represented. So that makes it hard to, you could possibly get a group to go to the legislature and ask for some kind of assistance, but we have no idea of how big this problem is. And we tried. Or I didn't.
That was
the staff tried.
Council, just to remind you that not everybody was at that meeting who's here today, but that was one of the things that the council asked staff to do, was to try to get a size of the scope, or a sense
Right.
of the scope of the problem. And we, as Bobby said, we just couldn't do that. The other thing I think Bobby said it, but I'll just say it again. One of the things that we talked about as a council is recognizing the impact on providers and small businesses, yet weighing the very clear safety record and the fact that every place else around us, both at the state and the federal level, has gone to not using 15 passengers vans, and we have strong federal regulations and funding that is tied to that. We wanted to put in place, or the council suggested putting in place, this time period to allow people some transition and not making it effective immediately. And that was I think at our November meeting that we talked about that. Further discussion, council? Okay, I'd like to call the question. We'll do a voice vote again, and we are taking these as a group. It is both the registered family home care rules and the central background registry rules as a group. So the motion on the table is to adopt these into final permanent form. Those in favor, please signify by saying aye.
Aye.
Are there any opposed? And any abstentions?
Aye.
So we have 2 abstentions, Charles McGee and Cully Ladd. Oh, excuse me, 3 abstentions and Eva.
I think I had some other questions too, sorry, and I was behind.
You were ruminating. Okay, all right, so the rules are permanent. Thank you very much. All right, we are, council members, going to take we're at a natural breaking point in the agenda. We are going to take about a 10-minute break. When we return, we will take up our strategic plan, which we need to put into final ratified form, and then a variety of subcommittee reports. We also, as Bobby indicated, we have a kind of a tee-up for the Child Care Development Block Grant funds, federal funds, some things that we need to do to prepare. I will return the public testimony sheet to the table during the break. So if you're interested in signing up for public testimony, there will be another opportunity at the end of the meeting. So we are in recess for 10. All right, we are going to go ahead and get started again, council members. So we are back in order. If I could have you find your way to your seat, please. And council members, we are expecting Marlene Yeskin, our council member from Southern Oregon, to join the line anytime now. So I've opened the phone lines as well. So thank you very much. Folks who are here from the public, the sign-in sheet is back on the table. If you desire to provide public testimony, please do sign up, and we will call last call for the final opportunity of public testimony in just a little while. So just a sneak preview, council members, of what's on our agenda. We are going to take up the ratification of our strategic plan, or the final version, I should say, of our strategic plan, followed by subcommittee reports. Under subcommittee reports, you have written reports. For new council members, it's behind your tab. Our practice is that we have a written report from all of our subcommittees and work groups. We ask you to read them, and you can pull anything forward, individual council members, into the agenda for conversation, but we only officially put on the agenda those things that we need your direction and or your action on. So with that practice, the only item that we have action needed today is the recommendation of the Early Learning Hub Metrics Committee. So that is formally on your agenda. We will offer you the opportunity to bring any other committee report forward in the agenda for conversation, but that is not the plan at this point. And then finally, not yet. So Marlene Yeskin, who is council member from Southern Oregon, will be joining us at any time. She's not here yet, but we did open the phone lines on break. And then finally, we will, before public testimony, take on a conversation about the Child Care Development Fund, which is a federal fund coming our way for renewal, and there are some general direction and information that the council needs to consider today. So that's the plan for the rest of the agenda. Before we get into the agenda, though, we neglected to make a very important introduction.
Yes, thank you, Pam. I was so excited to promulgate rules that I forgot that I wanted in my director's report to introduce a new member of the Early Learning Division team. Her name's Kim Parker. She's there in the back. Wave, Kim. She is our new director of business operations for the division. What that means is that she oversees and supervises the regulatory work of the division, so licensing, monitoring, compliance around childcare, and also more and more our other early learning programs as well, because we don't just have childcare facilities and homes that need to be monitored and in compliance. We have a whole suite of early learning programs. She also oversees our contracting, our internal operations, HR function with supporting staff, et cetera. And she also really likes working with board members. So for those of you who are on committees that have work that relates to regulatory work, you'll be getting to know Kim really well. She comes to us from the Employment Division. She came to the Employment Division from the Clackamas County Workforce Council. And before that, worked for Habitat for Humanity, but then way back in the day, has a child care background. She worked for the Commission on Child Care. She ran a child care resource and referral. She ran a Head Start program. She ran a community action. And so in a lot of ways, she's coming home to her initial love, but bringing all of the knowledge of workforce that she gained when she was in that world with her, which I think is a great fit. So Kim, I just wanted to welcome you and make sure that the council members had a chance to know who you are.
Yeah. You're welcome. We're glad you're here.
Thrilled to be here.
Thank you.
Look forward to getting to know you all.
Thanks. Okay, council members, the strategic plan. So this, I think, is behind tab 5. Is that right? No.
Tab 2.
Tab 2, excuse me. It's behind tab 2 in your binder. And just a little review for those of you that have been on the council and a bit of context for those of you that are new. This strategic plan we started to work on over a year ago when we had some outside contractors who did lots of work with informational interviews with every council member. We had focus groups. We talked about this when Lynn hosted us at Youth Villages. We talked about this at our Pendleton meeting. So we've been building this strategic plan over the course of a year or more. And then we had a retreat this fall that really started to put a lot of meat on the bones that we had been putting together. And then we talked about this again at our meeting in Eugene. So we've been looking at this in various pieces for a long time. The strategic plan is designed to be a rolling, iterative strategic plan, one that we revisit every fall in probably a retreat sort of setting, where we review tactics, we review progress on our metrics, and we make adjustments going forward, both in terms of what we want to do and by when we want to do it. And it also then allows us to sync up with the resources that the legislature will give us the previous, in this case, summer. So that's what we have in front of us. You saw most of this and actually adopted it in preliminary version at the meeting in Eugene, for those of you that were here. We called it our preliminary strategic plan because there were still some blanks in it, some blank spaces that you wanted us and staff, or we all wanted staff to help us fill in. And I will give you a concrete example of that, and then we will open it up for conversation. So for example, if you look on under goal 1, and again, these are formed by, our actions are formed by the 3 statutory goals that the legislature gave us, plus the 4th that we have added ourselves around being accountable and accessible. So under goal 1, an example of what was missing that we asked to have put together is under success metrics, the second bullet. We had some general sense of what we wanted in terms of targeted percentages, but we wanted to fill it in more precisely, and we wanted to get input from Bobby and the child care group and so on. So that all has been done between our last meeting and this meeting, and so all of the blanks have now been filled in, and we have a fully complete iterative 5-year plan to move forward with. The plan is indeed to do a version of this that doesn't include all of the nitty-gritty detail. We wanted it before you today, but that we can use in conversations with legislative members, providers, community partners, other agencies as we move forward. So that will be happening, but first we needed to get this adopted in final form. So I'll stop with the contextual comments and see what comments and conversation you have about our strategic plan before we adopt it. Lynn?
So, and I may just be missing it, the results around market penetration of the 104,000 kids on the financial sustainability of our work towards that goal.
Lynn, it may be, and Pam, you can chime in too, but it may just be the way that it's phrased. Under Goal 2, we want to increase the number of high-risk families served by 50%. So it's phrased as a percentage versus talking about the actual number. So it could be the phrasing on the metric.
I think it's really important to set concrete, measurable objectives, because that part of the difficulty here is if we don't get sufficient market penetration fast enough, we never achieve the objective. So I would convert it to a,
convert that percent to a number.
Yeah, because we have to track that.
And I think if council members are interested, we probably could do that conversion with all of these. These are formed as percentages, percent goals for the most part, but we could do that conversion so that we're clear at both percent and number, because at some point we're going to want to know that number equals, I mean, how far did that take us in terms of the goals? So maybe we need to have both. Yeah, we will put together a dashboard and a metric sheet. So.
And related to that is that connection to K through 3, right, or K through 12. So that not only do we have to do this work well, we have to ensure that the other metric tied to that is that the growing percentage of kids arrive in kindergarten ready to go. And that's a quantifiable number. That's a hard number that we can tie to the population of the state, the increase in the population, et cetera. But I think that holds us more accountable.
Great. Do you have other comments you wanted to make? I've got Dick in the queue, and then
you
Charles.
didn't answer the second piece, which is the financial piece.
I don't know that we have that in here, Lynn.
Yeah.
I didn't know that that's in here.
I think it's really important because and this is just because from 2011, the starting point of this conversation was that not enough investment is being made in early learning to be successful. And the only way to get additional investment is to show that the current investment is buying us what we expect it to buy. And so I think that's a really critical piece, because it's an academic exercise to discuss what needs to be added in terms of funding if we don't have a financial metric that we're holding ourselves accountable to.
Thank you. Dick?
Yeah, well, maybe in saying that another way is dollars spent gives you results, which equals value. And that's not me talking, that's that group that came in here in 2009 about how to change thinking and budgets for state governments and stuff. And I think if we have a scoreboard and then show the dollars spent and then what we're getting of the score going up, in other words, or having the benefits of that, then we may very well find out that we're spending money in the wrong places, we're not getting any return on investment on that. But instead of using the return on investment thing that I always pound on, which I really mean, but it's putting a value on how we're doing better, and you have to keep score to do that. And for some reason, a lot of commissions, we don't seem to want to keep score, you know. And so so if we can show the success metrics in a business model, so we can talk to the downtown folk and say, hey, this dollar is giving us the X return, and this is where we're short, and we can show you that if we had more money in this area, we can do better, or maybe we can just just the practical.
I'm happy to work with the director on language on this piece. I think this is a really pivotal piece. I think my hunch is, and it's no more than a hunch, is that part of the reason we have a disproportionality problem in Oregon is because we have not looked at the cost to result correlation. And so we have invested, but we need to strategically invest. Just as we heard the Salem Hub say last night that they sat down and thought of the 16 communities, there's not enough money to go around, but there's these 16, we get to these 16, we get further faster. That same approach applies to what we're doing. We have to decide how to use money strategically to get the 104,000 to get to that cost curve. So I'm open to any kind of language. I think ROI in business terms sometimes are off-putting in this culture, but I'm happy to use all the other kind of ways we can say that we need to invest for results.
I like the way you said that, but it's just a matter of not using it, that it's off to some people too.
Yes, totally understand. Totally get it.
All right, thank you. So I've got Charles and then Tim in the queue.
So what was the rationale, thoughts behind equity goals in the strategic planning process? Like, did we put any thought for that, or?
So, Charles, you may remember that at our retreat, we had a committee that was working on what those goals ought to be and what those tactics ought to be. And the work of that group is reflected here. And it's some of it, if I have to maybe turn to Megan, but some of it is reflected under the goal 4 that we have added. So we're not just focusing on the statutory goal. We've added a goal around accountability and accessibility, which is partly the equity piece, but then we have woven in some equity pieces in some of the other goals by virtue of that conversation. And then the last thing I'll say about that is that one of the next things on our agenda is the metrics recommendations from the Hub metrics group. They will be forwarding a very specific set of recommendations for the hubs, and there are equity goals embedded in those. They're in your binder as well. Follow up, yes.
So the one thing that I don't see is accountability pieces outlined in the equity piece. There's a lot around communication and engagement, but accountability to, I guess I wonder what are the accountability measures and indicators connected with equity specifically?
So those are going to come forward in the next presentation on the Hub metrics, and so if it's not, so we'll come back to you. If it's not sufficiently addressed in that, then we need to come back to it.
Okay. The other thing I would say to that question is that in the equity committee recommendations that are coming forward, there are really strong recommendations around accountability, and I didn't want to get ahead of the work that Marlene and Sarita are leading in that group, because I think that it would be misguided for me to do that.
I bring it up because of being in that group, and I know it has come up a lot.
It's really strong, so I think that when those really strong recommendations come forward, that'll get woven into here, because I've gotten sneak previews. They're excellent, but I didn't feel like it was appropriate to get out in front of that before it's presented in March.
And possibly even talking with sort of the Lynn group around the ROI and sort of the financial piece and how those things are tied together as well.
Yeah, and so council members, again, this is exactly why we wanted this to be an iterative plan, so that as we have pieces that subcommittees or work groups or what have you are doing and it makes sense to be woven in, we do that. And in fact, you're going to hear us say that when we get to the Hub metrics group. Tim?
Great.
And then Jim.
Thank you. And much like Lynn said, and I think we're going to agree on the number stuff quite a bit, having the numbers in there, if you're going to use this as a opportunity to educate legislators, would be very, very helpful. There are some legislators in the building that will know how many kids there are and what we're trying to get to by percentage. Others, especially the new legislators, they'll be seeing this for the first time. So if you're going to use it as an educational tool, having those numbers in there, or even if you adopt it the way it is now, having a follow-up with the numbers to help us communicate with the legislators would be very helpful.
Great, thank you. Jim?
Going back to the equity strategy 4.1, in 4A, it says identify and analyze service disparities for focus populations by hub region, which is great. I think it should also be comparative between hub regions. Well, one of the things called out, like Children's First, a report recently, and others is that and in the governor's equity lens, geography is an issue. And I think we're cutting off, if we just do within the hubs, we're cutting off a source of information about how well we're serving between regions.
Oh, interesting.
Yeah. So it's between and among.
Yes, because I think the work will be different.
Yes, Khalil. So one thing that I noticed on the family side, I wonder, are there, and I preface this, I haven't been as involved, so maybe this has been done already, or maybe it's not as relevant, but there's a lot happening on the K-12 side around family engagement, and it seems like they're, in the same way that we're trying to align standards and other things between pre-K and K3. I think we can do that with some of the family pieces as well, and so I wonder how there's intentionality around some of the family stability pieces. A lot of families that are in the K-12 system have younger siblings that are in the early child care system, so how do we be intentional about aligning them? And I don't have an exact suggestion on what that should be.
It's very hard that we're not doing the hub metrics at the same time.
I know.
Yeah. Because a lot of the things people are bringing up get very concrete in the hub metrics. So I wonder about the interplay between these two.
Maybe we need to finish conversation here, do hub metrics, come back and weave it together. That might make some sense.
Yes, that's what I was.
So let's so yes, there's something, Bobby's right, in hub metrics. It's also sort of sprinkled in here, Kali, probably not in the way that you are specifically suggesting, but one of the strategies that the council wanted to adopt was, much like we have an equity lens, really adopt a family engagement lens. And so that's reflected here. It's, where is it? It's 2F. And then there was another piece about aligning, and I'll have to find it and tell you, because I don't have it memorized. I'm sorry? Yes. Oh, so Megan knows, she's got them. 1 point, what? 5. Yes, and so it's the strategy 1.5 about a consistent and aligned pathway, and that's not limited to standards and curricula. That's really intended to mean family engagement. I think we have always thought, as an early learning council, that one of the things we have to offer that alignment is good engagement practices, and we heard that last night from many of the parents who feel, my word's not theirs, intimidated by the K-12 system and the lack of engagement practices, and we have felt like that's something we can bring to the alignment conversation.
But I think K-12 is actually doing more work, and maybe it depends on regions, in engaging community
on your region.
partners and things like that. I think there are things that one can learn from K-12. I don't see OD or K-12 really listed as a partner very concretely anywhere, and I don't know if that's intentional or not, but it feels like some of us in this room are in this sort of age 3 to grade 3 conversation, that we need to have them as partners to be able to think about these transitions.
So they are listed under the partners column in all of the 1.5?
I mean the family, sorry.
I'm sorry. The
section 2, okay. Goal 2.
Oh, all right, great, thank you. So we can add them as a partner to that piece.
I do think it raises the point, though, which is, and I'm assuming documents will go with this document or in a cover sheet, but in the founding documents of the ELC, it is abundantly clear that families are responsible for their children. They are the best teachers of their children, and that we are focused on families as opposed to systems I think that came out last night, but that's also part of our founding value set. And and I don't know if that will be attached to this, but it should be, because that's where this work begins. It's not about us, it's about them.
What else about this strategic plan for now, council members, and then we'll take a pause, look at the metrics recommendations, and then come back.
I would also love to see where community-based organizations as well as culturally specific organizations partner more clearly around some of this work.
Okay. Thank you. Yes, Tim.
The one thing about when you're writing your strategic plan, be very careful trying to list everything, because whenever you make a list, you leave somebody out. So try to use words that are more inclusive, and that way, as groups that maybe you didn't think about to get on the list sort of pop up, you're like, well, you're under this column because this is the inclusive of what you're doing. So it's just something that we learned quite clearly when we were doing the healthcare transformation.
Good point.
Lists are very challenging.
Good point. All right.
Sounds like a politician.
Anything else, council members, on this? Yes, Krista.
Thank you. I know you mentioned adding families under 2, the strategy 2, as key partners, and I would just add a really specific call out on 2F and the engagement of families in that conversation.
Okay. Thank you.
And great that it has a timeline.
Yeah.
I mean, council, this
Someone's
is
been hanging out with Lynn Saxton.
No, I love the timeline. It's so cool.
So this is your first strategic plan. Again, we see it as an iterative piece, and to that iterative point, let's take a pause. I'd like to ask David Mandel to come up to the table. I'm going to pass the gavel to Dick, since I chaired the Hub Metrics Committee, and I'm going to go join David at the table.
Charles, I want you to behave yourself in the next 20 minutes here.
This is when I act up.
Okay, David, welcome yourself and identify yourself, please.
Hello, David Mandel, Director of Policy and Research at the Early Learning Division, and I also staff the Hub Metrics Committee, which Pam chaired. And then Pam will introduce the work of the committee.
Great, thank you. Thank you very much. So we had a fabulous group as part of this metrics conversation, and it's behind tab 4 in your binders. The last page in that section lists the members of the Hub Metrics Committee. There were council members on this committee, Bobby, Harriet, and myself, and then with David and Megan providing staff support. And there were representatives on this committee from all of the hubs that were official at this particular point in time, as well as people who are certified SMART experts related to measurements and metrics. So we began to meet in the summer. We met twice a month. It was a big time commitment. And council members, you may remember that the genesis of this committee was that in the RFPs that we let out for the hubs, we had placeholder metrics that were related to the 3 goals, but they really were placeholder metrics. And this council wanted to engage people who were doing this work in community to help shape the metrics that they would be measured by going forward. And so that was the genesis of this committee. The committee worked very hard. Again, we met twice a month since the summer. And we bring today before you recommendations for this group. In terms of next steps, these recommendations and these metrics would be woven into contracts beginning in the summer when the new contracts are set by the Early Learning Division, and we would recommend that they also be woven into the strategic plan that we hope to adopt today as council members. I will say that not all of the metrics that you'll see here are applicable to statewide bodies such as this. Some of them are very specifically geared to hubs, and so not all of them would be woven into the strategic plan, but those that are applicable, we would recommend that they do. So let me just orient you to this document and our process, and then I think David and I are open to questions and comments that you might have. So we started off by, you'll see in the document, the charge that you gave us is represented here. I won't review it. But in terms of process, we started off by identifying principles that should guide the selection of our metrics. So there's a whole world, and people spend lots of time and get lots of degrees working on these kinds of things. We really needed to narrow the world. And so the principles for the identification and selection of the metrics we chose are listed on the first page of the document. So for example, we could put lots of things in here. We could measure lots of things, but not everything out there is under the impact of the hubs, or under the control, if you will, or the scope of the hubs. So that was the first bullet that you'll see here. You also will see, to the equity conversation that we had earlier, there's a specific principle around reinforcing a focus on reducing disparities for the target populations that we were given by the legislature, which includes kids of color and kids of low income and poverty status. So our outcomes are arrayed by the 3 goals in terms of recommendations. You'll see them there. And you will also see that outcomes are what we hope to achieve. The goals are really the long-term change that the legislature wants us to achieve, right? The system is aligned, and kids are entering kindergarten as successful as they can, and families are stable. Those are really long-term big goals. The committee recommended and articulated a set of shorter-term outcomes, shorter-term changes that are necessary in order to achieve those goals. Those are reflected under each goal area. And then further, those outcomes are further broken down by specific measurable indicators that would show progress to achieving those outcomes. Those indicators and outcomes reflect a sense from the committee that hubs are in really developing stages, that in the first couple of years of being a hub, what indicates that you are successful in making progress is really different, conceivably, than 5 or 6 years from now, and what would make you a successful hub at that point. So you'll see the indicators are broken down into shorter term indicators and medium and long term indicators in most but not all cases. So shorter term indicators are meant to be within a two or so year horizon, and the medium and long term indicators are intended to be longer than that. So I won't specifically go through each of these, believing that you had the chance to review them, but David and I would be happy to respond to any questions, and he may have other context he wants to add.
And just one piece of context that I want to add, particularly in sort of thinking about the short-term indicators, and as Pam talked about, one of the goals of this committee was also to really think through where the hubs currently are and their development, and a recognition that this is new, still rather experimental, but also to use this committee as an attempt, particularly since the people who are doing this work on the ground were in the room, to be able to really help bring out and articulate what the value added is of the hubs, and particularly their role of a community convener and bringing partners together to really work around a shared vision in a new, not only aligned but truly collaborative fashion. And I think that was a really important theme when we looked at particularly thinking about appropriate short-term indicators for this stage, because I think one of the principles that we looked at is also what are the kinds of incentives that are embedded in indicators, and particularly what are the kinds of short-term indicators that create incentive for that kind of cross-sector collaboration that I think we've all identified as really key to the hubs. I mean, to put it simply, what are the things that if you're forced to measure, people are going to work on in a new and a different collaborative way that we think will drive the system's change and ultimately make the impact that we want to see on children and families. So that was a guiding principle in this work.
Okay, any questions? Yes, Lynn?
So first I want to thank the committee for their work, and this again is a very exciting piece of the infrastructure, and I really resonate to what you just said, is what is the things you do that makes change happen, to rephrase a little bit, but with your permission. The one piece that I would like to see added to this is the, and again, I'm happy to talk about it in a variety of ways, but the original vision was to put an overhead constraint on the hubs. And the reason for that was we have a challenge with in Oregon, in many organizations, as we stand up new entities, ensuring that the most money goes to direct service people on the front lines. That has to do with buying new vans, it has to do with the equity piece, it has to do with engineering the system to be economically efficient. So you can do that in a number of ways, but without that metric, to your point, it won't happen. And we need to know that it's happening.
So can I ask a question regarding that? So you're referring to a cap on the administrative rate or the admin cost?
Yep.
So this is going to be a little controversial in your new role. I brought this up before in a different place. Public Health is currently dealing with an issue where OHA has raised our administrative rate from 11% to 17%. I find it really difficult that we as one state body are going to say to community-based organizations, you need to hold your admin rate at a certain thing, when the rest of state agencies are not being required to hold their admin rate down, and direct service delivery is being impacted significantly by that issue. And so I think we really need to be thoughtful as we're doing that we're looking consistently, because there's no cap on, the admin rate in state organizations can grow.
So I totally agree with you. And I think part of the challenge is that we as the state have a responsibility to own that part of it, that we absolutely cannot have our piece of it get out of hand and put the squeeze on the new service delivery models that we've established. Now the hubs are not, as we discussed yesterday, always going to be delivering service. Right. They're going to be procuring service. But again, I think that brings pressure absolutely back to the state to keep its overhead and its scale appropriate. Because without that, if you take 25% overhead in one sector, add a sector, give it 25%, absolutely. At the end of the day, 50 cents of every dollar is going to overhead, not to direct service. And it's just, if we don't engineer this right, that is what will happen.
And we still do have the statutory requirement that's part of HB 2013 that has a 15% administrative cap on resources that are allocated by the state directly to the hubs. So that's, that's still part of our statutory.
To her point, we need to own the back end of that and hold ourselves accountable. The whole system, we need to be able to look at the whole system and see what's going into overhead.
So, may I make a comment? So I agree 100% about the administrative costs. The one thing with that, if we're going to add that metric, and with all the metrics, is part of the policy was realizing there is a difference between the big city and rural communities. And there's kind of have to be, if you're talking about a cap, there's also got to be a minimum required to do the work.
Right.
So as a percentage, sometimes that doesn't really work as well as recognizing, if you're going to have a person sitting in a seat, there's a certain amount of dollars that it takes to do that. And percentage-wise, in a very small or rural area, that percentage may not work. So we just have to be aware there's a difference when you start using percentages.
Yep, and that directly speaks to the need for on some level we need an economic model projection to accomplish what's required in the statute for overhead, to accomplish the fact that, for example, in rural Oregon, you're not going to get as many people at certain educational criterias as you will in other counties. I mean, that's why I think we have to engineer the economics of this very carefully, because otherwise if it's a flat rule, it's not going to work in some places. If it's just you guys feeling pressure and the state isn't feeling any pressure to control its overhead costs, we probably could assign this as a separate work project, but it is the thing that will enable us to get the 104,000 kids taken care of. And if we don't do it, I just can guarantee it will never be addressed.
Okay. Any other comments? Yes.
To another point. Under Goal 3, the first outcome, that families have positive physical and mental health supported by access to high-quality health services, I would like to add, and healthy communities. It's well documented that access to health care is a very small piece of health, and under some medium and long-term indicators, I think, at least in my region, hub partners, although we're not the formal hub yet, are very involved in some efforts in Wasco County to reduce childhood obesity. And I think there are those, we know that childhood obesity influences education outcome and those sorts of issues. And so I think that if we add the healthy communities work and add in some medium and long-term indicators around that, we had a parent bring up the issue of school nutrition yesterday. That there are places we can influence the social determinants of health on a population level, not an individual level.
I just wonder if that doesn't belong under Goal 1. Because Goal 3 is about families, about communities is under Goal 1. Are you, it just feels like that the focus is different. If we're going to hold hubs accountable for something that is community level, population level, it feels to me like it belongs under Goal 1.
Megan, you got any comments?
I do. So maybe I wanted to make a public commitment to what Lynn has brought up. So maybe folks can ruminate on what Bobby and Terry just surfaced and think about where it fits while I do that. To tie this conversation back to the strategic plan, under Goal 3.2, we have a strategy around biennial development of the comprehensive children's budget. I would think maybe we should strengthen that. The comprehensive budget is a starting point tool, but it could be that the council wants to ask for that to be strengthened, where the comprehensive children's budget actually becomes the foundation of that cost modeling and we do something with it. So just to connect your comments about the need for a clear financial model around all of this, I think weaving that into the strategic plan there would be something that we could do, Lynn, and I would love to work with you on how and what the next steps of that look like.
Let me piggyback on that. David, is there any way that there's a value, like on a T account, that you would have what we want for our outcomes, but we show what the value of that is? If we do X, then we have a value there for doing that. So this can be shown that it's just not words on we're trying to have these objectives, these goals, but then if we attain them, then that gives us the value. And because there is a cynical downtown that says, you guys are just doing this thing, but this is a real pro forma of what success is for a state, a community, your neighbor next door. And so there's a value to that.
So I'm going to give a horribly policy wonky answer.
Okay,
so
good.
I apologize in advance for using these two words.
Remember what Dick Alexander would have told you to do.
But I do think that one of the next steps, particularly in the next iteration of the work with the hubs, because I think all of this is also just about getting very clearer about what are the key activities and and what do those key activities drive. So part of my thought is that one of the next steps in working with the hubs in their next reiteration of their strategic plans and embedding these metrics is also to really more fully articulate the logic model of how these particular steps drive change. And I think that's, in some sense, the first step in being able to more clearly articulate some of that value-added work. So I apologize for using the language of logic model, but I do think it might be a next step in helping to get there.
Okay, good.
I had just two thoughts. One is Under Goal 2, under the 4th bullet, there's conversation about seamless transition from early programs to kindergarten. And I know that a number of early learning hubs and also grants out of the Kindergarten Partnership and Innovation Fund have focused on the strategies between K-3 and preschools and helping parents and early learning providers make those kinds of connections. And so I'm wondering if we might consider some kind of a short-term indicator that would allow us to recognize and also encourage more of those kinds of activities that support the bigger outcome.
Do you have a suggestion?
Yes, I do, as a matter of fact. The number of, and this, I just threw language down, so the number of shared activities between early learning environments or preschools that support seamless transitions. But I think the key element in any kind of language would need to include in the involvement of both early care and education providers, families, and K-3 environments. Something that would incorporate all of those and the number of those kinds of activities, because folks are doing it in different ways. There's, you know, like ramp up activities, and sometimes it's just a visit to the school district, etc. And then just second comment is on goal number 3 around families that are healthy, stable, and attached. The big outcome of adequate resources to meet their needs. I think that covers a lot of things, and I think if we're willing to call out housing, transportation, it might be helpful also to call out job training, education, economic development opportunities. That kind of links back into the idea of communities, and so you could argue where it needs to go. But on some level, that seems to be an incredible driver to increasing family self-sufficiency and stable and attached capacity.
Before we go on too much further, Terry and Bobby, you guys decide where you want to put this thing?
Well, I just, to my point, maybe just the way I phrased it, maybe healthy environments would be the better way to put it. I'm really, my thoughts are really along the health, not the community engagement. And when we look at the community partners that are listed under that goal, I don't see engagement in population health and upstream prevention really as part of that. I see that access to a healthy environment is different than just community engagement.
Yeah. So what I was understanding you were saying, which I think makes sense for this goal 3, is it's about not engagement with the community, but the context in which families are living and the impact that has on health.
Right.
That's fine.
Yes, I'm sorry, Karen.
So I have a couple comments on goal 2. One is bullet 3. I think there needs to be something added around promoting positive and culturally responsive child development. And I think that there, an indicator needs to correlate with that talks about, there's nothing here that talks about sort of culturally responsive practice. And again, I live a lot in K-12. We talk a lot about it. It really does impact children's sense of self, particularly in the early years. Culture plays a really big role, so that's showing up. I'm also struggling bullet point 1 on the outcome side in goal 2, children arriving at kindergarten with the social emotional piece. I don't see a short-term indicator that fully connects with that outcome. So I think the social emotional piece is absolutely critical, and there needs to be some indicator that is stronger on how we're going to support children to have the social emotional competencies to be successful. And I don't have one to offer right at this moment, but I can think about it. And then on the goal 3, the families, healthy, stable, and attached families, I think, actually, sorry, let's go. I have one other comment on goal 2. The QRIS all the short-term indicators are heavily reliant on QRIS. There are a lot of children that are sort of outside of that QRIS thing, and I do not see any indicators relevant for them. So I'd like to see family, friends, and neighbor called out in some way, and how we're going to support them, an indicator that exemplifies that link and support.
So one of the things, and this is a good time maybe to say it explicitly, council members, that the committee struggled with mightily. is that we have outcomes, which is the change you want to see. We have indicators, which is how we're going to measure it. And then really, there's a layer that's not explicitly called out here, which is, do we have ways to measure it, right? And so some of what you have here is here by virtue of the fact that we can measure it and we have the systems available to measure it. We don't have the mythical data system that we've all been talking about since the beginning. And so I want to acknowledge that there's a lot that needs to be here, but some of why it's not is because we have no way to go out and get it, and that to prioritize going out and getting it would disable us from doing other work. And so I just want to be clear that when we're adding things, particularly if we're adding things that there isn't a way to go find out and report on, it's going to be really difficult for us to collectively to do it. And what you just talked about is a great example of that. Not that it shouldn't be here, and not that it's not important, but we have some very significant measurement challenges in this field right now. And I know the council has it on the strategic plan, but some of what you have here is bound by that reality.
So I wonder if there's a way that the hub and the connection with the hub could do that. My concern is that, and I've heard this from providers, QRIS, some of the QRIS providers, they are more expensive. And so who has access to them winds up not always being the most underserved kids. And so I want to make sure, I don't know, I hear what you're saying. That's a big issue in early learning in general. But I would hate to not determine something tangible, a tangible indicator that is reasonable when it comes to data collection that we could at least track.
And that was at least part of some of the thought around the indicator tying ERDC access to QRIS, was to thinking about who has access to it and also thinking about the resources to make access actually available.
Jim, Kelly, and Megan?
So as I read these, I'll repeat myself, as I read these things, a lot of these are simply aspirational. If you look at the third bullet under outcomes 3, families have adequate resources to meet their needs, housing, transportation, support, strength, and resilience to stress. That's a whole community outcome. How can we hold the hubs accountable for that? And how in heaven's name do you measure that? It feels uncomfortable to me to put it on responsibility for that on the hubs. And I think it would be at least important for us to, maybe we could put a little A next to these that say they're aspirational. We recognize we need them, but I don't know how we hold the hubs accountable for something they have. They're paint on the furniture, to go back to my old phrase. They're not significant as a player.
And I think that's one of the places where some of the, for lack of a better word, the space between the outcomes and the indicators is partially part of that story, right? In the sense that part of the outcomes is sort of to direct what are those aspirational goals, being pretty clear and intentional that both the resources, authority, and space to which hubs have to operate is fairly circumscribed. So I think part of the goal is to sort of think about what are those indicators that drive work, where the hubs can actually have a meaningful impact in a meaningful time period that drives towards outcomes which at times are more aspirational.
And just to make a very specific administrative comment about that, the outcomes here are not what we're going to be tying their contracts to. The indicators are. So that's why we looked at the more specific short-term things that you could actually hold someone responsible to in a contract. But the committee felt really strongly that we didn't want to lose the big aspirational vision, but acknowledged that the hubs don't have control over a lot of things. And actually Bobby spoke quite a bit about that in the committee. But for the purposes of how these play out with the hubs in the very short term, the things that are listed as short-term indicators are things that we think we can tie together in contracting that they can move on.
I think it creates a very healthy tension because the real power of the hubs is to change the way existing organizations look at what they're doing and start behaving differently in more collaborative, coordinated ways. And that's to get to the outcomes. And so we dare not lose that, because that's the power of that the hubs have, is if we work together, we can make our community achieve these. But just for all the reasons you said, there are a lot of steps to get there. And the hub, as you said, is only one player. But if you'll notice, spread throughout here, there was a lot of emphasis put on the kind of relationship building and development that hubs are doing right now, or we will never change our communities. Because we'll never put enough money in to reach these outcomes. It'll only be if the hubs really convince all of these players that there is something more important than what they think they're there to do, and that if they work together, they can change their community in these ways. So if you'll notice, there's a lot about holding hubs accountable for building the foundation so that this is really achievable, but it'll never be achievable by the hub as with the money they have. It's going to take us deciding to behave differently.
Colleen?
I wanted to go back to the family, friend, and neighbor. I know that the other states have some programs that have now done evidence-based research on the programs. Arizona is one. The report, if it isn't currently released, will be very shortly. So I think that there is a way to include them and work that in. I mean, it might not exist at the moment, but I think that if we acknowledge that there are ways to do it in the future, we should.
Martha, Tim?
I agree with you, Bobby, about putting enough money in. I mean, we'll never be able to get there, but can we put enough to move the needle? And I think that's where we need to go, and push for that particular piece, the right investments at the right time. I have a question on this. What I see through the document is that you have family resource centers, DHS, ERDC, Head Start. Am I missing a piece on the early childhood, the 0 to 3? I don't see our own program, Healthy Families, mentioned. Early Head Start is not in there. And if we don't get them started in that early brain development piece, then...
I think that they're not called out so much in the indicators because part of the role of the indicators is to get folks thinking of beyond the traditional early learning program. So I think they're not called out because they are seen to be there at the table. I don't know if that's the right way to put it. I mean, I think so many of these indicators, the notion is that you can't do it without those programs at the table. And I'll just use the one example I always use. One of the reasons that we put the on-time enrollment in kindergarten on the table is because that is that it's an incentive or indicator that helps schools think about what it actually means to engage with the early learning programs in their community. With the Head Start programs, with the child care programs, with the home visiting programs, because they're not going to be, hubs can't address that and schools can't address that unless they actually know where the kids are before they get there. So I think sometimes that there is the goal, even though when some of those parties were not called out in the indicators explicitly, the goal of the indicators was to incent particularly those kinds of relationships that you're talking about.
I'd push back on that a little bit, David, because within the document you have called out programs, and not to address your 0 to 3, but basically go to your 3 to 4-year-olds. I think a piece definitely is missing. Whether you take the document and say we're going to be more generalized, or whether you're going to name program specific, to me it needs to be consistent. And I see that as an inconsistency.
So one of the options, if the council agrees to that point, Martha, I think there is an outcome that addresses what you're talking about under goal 3. It's the second outcome. It's maybe even a version of the third bulleted outcome. But the indicator, to sort of weave together the previous conversation with this one, could be that those programs that are in the span of control. The other problem here is that those programs don't go to the hub. Right, so it's not really there's a span of control issue, but they are under the jurisdiction of this council, and we expect them to be connected to the hubs. So there is an indicator around expecting the connection to the hubs, number one, potentially, and there is also an indicator about expecting that those programs are serving an increasing percentage of the 104,000. Because we do know that there are some of those programs, not all, that serve kids who aren't part of that 104,000. So I think there's an indicator or two that could be crafted to bring the previous conversation into this one.
Yeah, and for me, I prefer a little more clarification on that, and to call out that earlier piece. I don't think it's strong enough for me.
So a couple things. One, as we're talking about this idea of getting people to coordinate and collaborate, we got to remember also in that we're trying to get some innovation. So if we're too specific on what we want them to do, if we make a list, I'm going back to my list, they'll do what's on the list and nothing more, because that's all they'll have time to focus on. So let's be very careful with that. And that sort of leads into my second point about another part of the policy was to have some regionalization, because we recognize a one-size-fits-all system very rarely works. And quite honestly, usually when we do a one-size-fits-all system, it is how it works in the big city. It's just the nature of the legislature, the way the makeup is. That's really what comes out with a one-size-fits-all. So things that are very important in the urban part of the state for focused populations, and we heard that yesterday. I think we heard 45% were Spanish-speaking that the students are trying to serve. That number is far, far less where I'm from. But I will guarantee you the poverty and the generational poverty that we're dealing with is no different. So we have to be careful to ask for those type of things that are the most important for the people within the hub that they're serving, not statewide.
You've been in one county out of 36, right?
Yeah.
Carl?
A couple comments. One, I would just add to that and say even within the urban areas, a one-size-fits-all approach doesn't work with different populations. So I sort of concur. And I wanted to say, Martha's point I think is really salient, and I think I struggled with goal 3 indicators as well, because I didn't see the outcomes aligning well with indicators. I understand the importance of EDRC, but you're not going to reach all of these outcomes because you get more children enrolled in EDRC, especially because families are coming in and out of EDRC. So I think there needs to be more substantial things, I don't know that we have to create lists of programs, but something that calls out particularly 0 to 3 generally, and ensuring that there's increased access to supports in that area. I feel like there needs to be more there.
Can I make one quick comment with this? That we start looking at this prenatal to whatever instead of 0.
Yeah.
Jim?
Preconception, sorry.
So I originally wanted to respond to Bobby a little bit, but to all the stuff since then. This whole area, I don't want to argue against the outcomes in goal 3. I think they're all great. They're aspirational. I'm worried about how we think about those and how our staff think about those. I'm having such a terrible case of deja vu, because the kinds of things that we're talking about here and the limited money and the aspirational versus lack of control is perfectly mirrored in the last 50 years in the community services block grant, which is the core of the community action agencies. We're charged with all those same sorts of really big aspirational goals, no money. We're supposed to go out in the community, coordinate them. And my first experience in a negotiation was to come to the table, and the person across from me said, well, what do you bring to the table? In the case of the hubs, I'm representing truth and light. You should just follow it. That only goes so far. And you have a choice if you're working and you're really trying to make partnership between being an advocate like that and finding a way to cooperate. You have to work both sides of that. So one, I guess what I'm really arguing is that the staff take a lesson from that they look at, rather than hard, well, what have you done about this and what's your things, and why aren't you like this community, recognizing that we may have some power here, as Pam suggested earlier, within the Department of Education, or even in talking to other agencies and saying, well, in Columbia County, I'll use my county as a bad example because it's not, how come DHS isn't talking to their community action people? Well, maybe that's a DHS thing. How come the local mental health provider isn't working? Maybe Lynn could help with that. But I think we have some responsibility to look, say, why isn't this working? It may be the hub, it may be their environment. And it's not going to be the same from county to county, and they may need some help to make that delivered there. And if we could make that extra step, we'll go a lot further than our experience at Community Action over the last 50 years.
Megan, I'm wondering if it's worth me saying just something about what's in the governor's requested budget around hubs, and sort of how we're sort of thinking of the intersection of the work around metrics, and also thinking about. Do you want me to do that? Okay. You know, so one of the other reasons for doing this work and doing it now is something happens Monday. The legislature comes back and starts working on the budget, and we're in a really wonderful situation with a governor who's made early childhood a really high priority, and there is $20 million of new general fund money in that budget for hubs. And I think one of the things that's really clear is the coordination work really takes time and needs to be resourced. If hubs are really going to be serious about family engagement, that also takes time and resources. But I think one thing that's also really clear is while the hubs are not becoming the direct provider of programs, they do need some resources that they can invest in the community. That if they're going to be able to find, to articulate gaps, they do need some way of at least starting to address them. And I think beyond that, they also need resources to bring people to the table, to have concrete projects that really get people to work. And one of the really interesting things to have seen unfold in the last year in this early stage of the hubs is how the Kindergarten Partner Innovation Fund, which was sort of created outside of the hubs, but many hubs have been able to access, having that pot of money, which they're not spending directly so much as investing in particular projects with elementary schools and early learning providers, how that's created on the ground a new conversation between early learning and K through 12. So I do think it's really important. Well, one of the things I'm really glad is that I think the governor's requested budget makes possible that kind of a potential ability to hubs have some, still probably pretty limited resources to engage in some of those areas. So just in our own sort of internal thinking about how those resources would be allocated is to sort of say, yes, there needs to be some real resources for the coordination work, and real resources for really engaging communities and families. But we also need to be thinking about what are some resources the hubs would have available to invest around school readiness, with a parameter including making sure that a significant part of that investment goes to 0 to 3. What are the resources that around health and family stability that the hub could have to invest in the community, to bring DHS to the table to say, here's something that we can do, and we have maybe not a lot of money, but some resources to make that possible. So I think of this as also a companion to that conversation that we're going to have with the legislature. And as always worth saying at this point, it's really wonderful what the governor has put in his requested budget, but we also know that there's a long, long time between now and July and finalizing the budget. So I think part of it is also to help us articulate what would we be buying with as a state if we were making this kind of investment in the
Jim,
hubs?
before you and Tim, Pam, maybe at the end of these two, you could wrap this up and then we'll move on.
I think I'll come and to come back to my seat. David's fully capable of responding to questions, and then we'll weave this together with strategic plan after the next two that you have in the queue.
Tim?
Also, I was going to mention around the dollars, and I'm very grateful for the governor's pointing me here, and also to his investment in his budget. The one thing I would tell you is sort of a fun exercise, a budget exercise. If you take all the dollars that are focused at this population, both state and federal dollars, and you add those together and divide them by the 100,000 people that we're trying to serve, there's one metric you can fix without any program. You can take them out of poverty. So understand there is a lot of dollars in the system. It's just a fun budget exercise, and I'm not suggesting that we should recommend that, but it's sort of, I mean, it's sort of amazing when you start to put all the programs together and start to add the dollars up, including the health. You put all that together, and it's a huge number. To say, we need dollars to help coordinate that, some of these other programs need to step up and help us coordinate that, and I just, want to kind of get that on the record. There is a lot of money in this system.
Tim's up to bat here.
Okay.
So I just wanted to say two things. One, I'd like for us all to be clear that special fund you just talked about is not admin, it's program. And then secondly, when you're advocating for that, sign me up. Okay?
And I don't know where this fits with the model, and I'm going to have to excuse myself and go to another commitment. Every hub is accountable for identifying in its parameters, its boundaries, how to get the job done. And they're responsible for identifying how big is their population in their area. Some parts of the state it's smaller than others. Poverty is also related to geography. And so what we need to ensure is that they have done the analytical work as opposed to meeting all the metrics, right? Because it can't just be we're going to do all these good things and it's going to be great and it's going to work out. It's got to be we got this many kids, we got this many families, we got to get to this many in this time. We're going to use our resources in this way. Head Start may take up this many of the kids, other programs, but that analytical piece before they start meeting the metrics is key. Because without it, we don't, again, it's the engineering, we don't get from A to B. And in some areas, they can absolutely, the hub can say, our first grant proposal or our first asset allocation is to family and neighbor services and to getting that documented for outcomes and quantity and barriers. That's, we expect the hubs to make those calls. What we've got to get from them is information to ensure that they're making calls as opposed to funding status quo. And I don't know where that fits, but it's the critical piece. The thought piece is there's a market, there's a goal, there's an amount of money, and we got to get from A to B. And the simpler we make that in Oregon, the better we do, because we have a little bit of ADD collectively. And we're not going to get from A to B if we don't just acknowledge that problem and get all over it. So, thanks.
So let me try to weave this together. I actually think that we've coalesced around several key actions. Let me try to summarize them. And I'm going to bounce back and forth between the metrics committee's recommendation and the strategic plan, because that's what we have done here. So overall, I think what we have said in terms of contracting with hubs, that in addition to the metrics, which I'll come to in a moment, we want to make sure that the hub contracts reflect the 15% overhead expectation. They do now, but we want to continue that. We're under a statutory obligation to do so. We also, I don't know how we say this, but it's Lynn's last point here, of creating an expectation that it's not just meeting metrics, it's the process of analyzing them and continuously improving to drive to results. And so I don't know how we set that expectation. It's really a cultural expectation. I know you're working on that on the learning collaboratives that we have, but I think you heard that strongly from us. So there's sort of this Uber piece. Relative to the metrics recommendations, I think that we have said relative to goal 2 that we want to reflect the culturally responsive expectation, and that needs to be woven into outcomes, particularly the third outcome here. We've suggested adding a couple of specific indicators which we think are measurable or potentially measurable. One is around the number of shared activities that occur among and between early learning providers, families, and kindergarten K-3 to support those seamless transitions. Second, we want to add a metric, don't know yet how we measure this, around increasing the percent of kids who have social emotional competencies to tie to the outcomes. Moving on to goal 3, we want to make sure that if we have this aspirational goal around positive physical and mental health and high quality access to high quality services, we're including that includes healthy environments and communities. We also want to add a couple of indicators, one of which we called out, one of which I'm going to call out from this broad discussion. So the first one that we talked about was increasing maybe the number and percent of programs who are serving the prenatal to 3 population of young children and their families who actually are connected to and participating in hub conversations. So that we aren't just about kind of the 4, 5, 6-year-old conversations, right? So we're calling that out as a specific metric. And then related to that, another indicator around increasing the percent or the number of targeted population families who have access to high quality family development and support services in that young age group. This, I think, some of Martha's piece and also Khalid's. We would want to reflect those in our strategic plan in the appropriate areas. And in our strategic plan, we want to be clear that we are looking at both percent and quantitative number as we set our targets for success. We want to add a financial piece that is connected to, and I lost the number, maybe Megan has it up. Yeah, the comprehensive budget, which is, I can't remember what one it is. 3. Sorry, I had it and I lost it. Oh, thank you. It is.
Tactic 3F.
So it's under 3.2 that we would add a tactic related to the development of the comprehensive children's budget, which would be the development of an economic model tied to that comprehensive children's budget that would support the movement that we need to have here. Lynn suggested a work group. Maybe it's a work group. I don't know what it is. Maybe that's how you get to it, but it's the development of an economic model that we've been talking about since the beginning. And then particularly related to goal 4, we want to make of the equity piece that we're talking about when we're looking at issues related to disparities. It's between and among hubs. It's not just by looking at things by hubs. And then we talked about being sure that we are making sure that as we do this, that some of our key partners involved, the Department of Education and families as well. So, did I get it? Did I miss something?
I love the look you just gave me. So if 40-40-20 is sort of our thing here, how are hubs reporting back to us regularly their engagement at reaching sort of those goals, especially as they pertain to our target population? Yeah.
I'll ask. There are processes that staff have been setting up, and I don't think we're done yet, but maybe David or Megan can say a word about what that looks like.
So starting with the metrics, since that's where we were, one of the things that we've said in the metrics is that all of them need to be disaggregated by populations, and so that's part of the tracking. On the systems level, part of what we're also really looking for is documented evidence of really engaging culturally specific community-based organizations in the work of the hub. And to be honest, I think that's also one of the reasons why having some flexible resources that goes through the hubs is so important. I think that will really enable there to be an opportunity to have more direct investments in community-based organizations. I think that's part of what we're going to be looking at as part of the work plans and the deliverables and the renewal of the contract.
So they will be reporting back?
Yes.
Perfect.
Yeah. And then just the next, we still have a work in process to doing this, but really making sure that we're also disaggregating program service levels by populations and reporting that back to the hubs and making sure that they're looking at that and addressing disparities.
Okay.
So I think now's a good moment to just call out that we have, it's referenced in this document, in the metrics document, but let me just call it out specifically for the record. We have 2 other work groups that are actively working on metric-related things that probably would need to be woven into our strategic plan when they come forward. One is the Equity Committee that Marlene chairs. I don't know, Marlene, are you on yet?
She had it.
Okay. So, it sounds like she's not on yet. So, but anyway, in March, the Equity Subcommittee will be giving us recommendations. Those will need to be woven into the strategic plan. And then we have a joint committee with the Oregon Health Policy Board. So for new members, we have a joint committee with a policy board that governs health transformation. And that joint committee is working on metrics that are shared metrics for family support and well-being across early learning, healthcare, and human services. And so those are forthcoming, and there you see that there's kind of a reference and a placeholder, but those will need to be woven in from both of those groups when they come forward. So again, an iterative strategic plan that we'll need to sort of roll in. We don't have all of the missing pieces yet.
So,
make one final comment.
Please do, and then go back to Charles.
And I'll listen more and not talk as much.
No, please.
I'm going to put my local hub chair hat on, and I apologize for that. But what we're seeing down there is there's a real difference between administration, which is sort of filling out all the stuff for you all and keeping the thing going, and then the function of coordinating. And right now that sort of all gets wrapped together as administrative dollars.
Yeah.
And because we're sort of trying to drive the coordination piece, much like Jim said, some of the people you're trying to coordinate, you're not bringing any dollars to the table, so they don't even want to visit with you. And they have no pressure or reason to bring dollars to the table. So that coordinating piece really is different than the administration. I just wanted to point that out, and we should be intentional when we talk to hubs and recognize the difference between those two functions.
Absolutely.
Yes.
I think we have, and maybe it's a time to revisit that before we get to contracting. We have a definition of what's included in that 15%. I don't remember how we handled coordination.
I do.
Great! How did you?
I do.
We allowed for coordination counts as program, not administrative overhead, because it's so core. It's exactly what you just said.
Okay, so council members, then, with those changes that we saw. Oh, I'm sorry, Charles.
You keep forgetting me, Pam.
I do. I'm sorry.
So, I'm generally extremely critical of processes, and I have to say that I am extremely proud and happy about the work that the council is doing, and I think it's amazing. It's kind of cool. So,
yeah, I want to rest in this moment.
Just enjoy.
Nice.
Could we get that little sound back so we can all have it on our
Just gotta say, it's amazing.
All right, council members, so with those changes, and Charles, moment of celebration.
Quickly.
Not done yet.
Is there any objection with those changes? And again, more to come on the strategic plan. Is there any objection then to accepting the Hub Metrics Committee recommendations and ratifying this version of the strategic plan? Is there any objection?
So moved.
Okay. All right. We've got a second by Kim. Sorry. Any objection? All right. We have a strategic plan, an iterative strategic plan. We have a set of metrics and a happy Charles. What could be better? That's right. All right. So, council members, we are in the home stretch.
Chair, can I ask a question though first? This is just a process question.
Yes, absolutely.
So the changes that we just discussed, when will you come back to us with the next version or the changes or
the changed version?
Yeah.
Staff will be making those changes and we'll send out the revised version to council members.
Okay.
All right, so back to our agenda. We're still under agenda item number 6, which is subcommittee reports. I'd like to, under a consent agenda, just acknowledge the receipt of the written reports, unless there are written reports or any reports from the subcommittees that you want to bring forward for conversation. Any committee report any member would like to bring forward for conversation and discussion? Okay. Hearing none, then we will accept and acknowledge the receipt of those reports and thank council members and others for continuing their hard work. And we will have before us at our next meeting, council members, recommendation from the equity subcommittee that Marlene is chairing. So now I want to turn to David and Bobby to talk a little bit about the Child Care Development Fund that is coming our way. And this is behind tab number 5. 5? Kim says 5.
Do you all have it? Okay, good. And we have copies of
Yes. Tab 5. Thank you. And so while they're getting settled, council members, I'll just tell you that we have a PowerPoint on this, and procedurally, we have a little, we have a lapse in time. So we have a meeting in May, and we have a meeting in July. This plan is due in June, and we don't have a meeting in June. So the plan at this point, unless you tell us otherwise, is that the work will go forward as Bobby and David are about to explain to you. We will have an overview in May of what the plan contains. You'll have an opportunity to suggest any adjustments, and then the executive committee will approve it on behalf of the council at their June meeting, unless you tell us otherwise today. Okay, please.
That's a great introduction to what we're doing today. So, what moves it? Oh, okay. We're here today in January for something we have to do in June because we want to give you a background and enough time to ask for any information or engagement that you would like to have. So we are going to end this presentation with a time for you to say, it'd be really helpful if we had more information about A, B, or C. One of the overarching problems with the whole field of early care and education is it's got its own language. And it is very hard for people who don't live this day to day to sometimes understand what people are talking about. So that said, you should stop us anytime during this presentation. So here we'll start with the lingo.
And then let me just sort of go back up one step. So, I mean, to go back to what
you want to go back.
Pam mentioned, and Bobby's going to talk more about what this means, but we are a recipient of $135 million over the biennium through the Child Care Development Fund. With that dollars come the requirement for us to submit on a biennial basis a state Child Care Development Fund plan. As the Early Learning Council, it is your ultimate authority to approve that plan. So what we're trying to do today is just set up when we say we're asking you to approve the plan in May or June, what does that mean to be saying that we're asking you to approve this Child Care Development Fund plan? So what we're going to do today is a pretty high overview so that if we send you more, inundate you with materials, you'll know what that means. So it seemed like it would be better just to give you a sense of what this is and what we're actually asking you to do before anyone sort of sent out a copy of the plan or any of that. So this is just to sort of set up what those questions actually are and what that entails.
So we're going to start by talking about just what is the Child Care and Development Fund plan that David just referenced, and then how Oregon uses it, because when we talk about it's a block grant, so the states have some discretion, not total. There's quite a few federal rules about how those dollars can be spent, but we have some discretion. And what is the plan itself? Because plan says things that this necessarily isn't. So we'll talk about what it is and isn't. There have been in November there was a major revision to by the Congress that is going to have big effects here as in all states, and so we're going to highlight some of the changes. I think there's some level of awareness that these changes are coming, but I'd say for the most part people don't know what's coming. And what's the process that we'll be going through for revising the plan. So David's gonna, the purpose of the fund is to provide financial assistance to low-income families so they can access childcare while they work or attend job training or educational programs, but it's also to provide funding to improve the quality of childcare and increase the supply and availability of childcare for all families, including those who don't receive any direct assistance. For the quality piece is designed to improve the entire child care and education system. So I think what's important is the United States started putting money into child care in the late 80s. Well, there was some initial funding in '69, so I guess you could talk about that. The first real money, and it wasn't very much, came in the 80s, and then with 1990 there was a big infusion. In '96 it was even bigger. It's still not anywhere near the need, but what the Child Care and Development Fund is it weaves together all these federal streams of money into a single fund that the states then are given to administer. And I don't think we say this, but it's important to note that no matter how you define eligibility, we don't even come close to serving those. It's under 20%, even when you use our own state rules. If you used what the state could use as eligibility, it would be probably below 10%. So so when we say, when we talk about how much money it is, and it is a lot of money, that needs to be put in the context of the size of the need that we're trying to address. So, here's pretty much I'm sorry, I did forgotten that we actually had a slide. This just what I already told you. But that 2014 reauthorization did a number of things. It strengthens health and safety requirements, and it also increases the focus. So there's been this tension since the 60s between, are we doing this to help children, or are we doing this to get parents to work? And the legislation consistently has said it's to do both, but the focus hasn't always been equal. And the 2014 action by Congress was to balance the scales so that the focus on what happens for the children was given more attention, more focus.
So this just gives you a little bit of a high overview of how Oregon's CCDF allocation is spent. So as I mentioned, it's about $135 million over the biennium. Close to 81% of that goes to our child care subsidy program for low-income working families, employment-related daycare, which is run through the Department of Human Services. CCDF rules require states spend at least 70% of that on their child care subsidy program. And that 81% that comes out of this fund really is the vast majority of the money that goes into employment-related daycare. At this point, I think it's about 90% is federal CCDF funding. So I think the bottom line from this slide is we would basically have no child care system in this state without CCDF. It pays for our licensing. It pays for our child care resource and referral networks. It pays for many of our investments around professional development. So it is really the foundation for, it is the foundational resource for so much of the investments that we make around early care and education in this state. The other thing to note about this is, as Bobby said, federal dollars always come with one or two rules attached to them, and I am by no means an expert in those rules. And in fact, the rules are so complicated that the two folks from our division who work most on this actually have been sent to Washington just to, in part, to actually find out what the new template is for the CCF plan and update on these rules. So, there's a lot of, I don't want to go into great details about it, but there's a lot of specific rules about percents of quality investment, percent of investments in infant toddlers. And the other part that's also worth noting is the legislature. It's also in their prerogative to provide very specific directions on how these funds are used. So the allocation of these resources, is a sort of I would say, a complicated dance of federal regulations, legislative direction. Is partially what guides that conversation of how those resources are allocated.
Our legislature plays a very key role. Some states, the legislature is not so involved. In Oregon, our eligibility, our payment rates, our co-payment rates all go through the legislative budget process. And so there's that's a very important piece of understanding this program, is that there is a very definite legislative role. And the legislative investment goes up and down. We in 2007 we saw a huge increase. By 2009 we lost it. So the federal funds tend to be more stable, and they have been consistently going up. The Oregon share is less stable.
Thanks. Was anybody else in the queue? Sorry. You said the floor for the subsidy is 70%. Did you also talk about the recommendations around quality? Like is it 4%? At least 4% go to quality, and
it just got increased.
It's just currently something like 4%, and it'll go up to 9%. And then there's different definitions of what count as your quality investment. Yes. Yeah.
And then I had a second one. Sorry, it left.
It's okay when it'll come back.
And then the federal recommendation for reimbursement is still 75th percentile. Is that correct?
Yes. Okay. That's complicated, but of what parents have to pay in the marketplace, in their community, yes, they would. That's the recommendation.
And I would say, if we want to talk more about employment-related care, we can as well. But I would say we're actually at this point pretty good about national standards for that program. And it's also probably also worth noting that there is a bill before the legislature, HB 2015, which will have a public hearing on February 9th, that will also look at employment-related daycare policy and make some recommendations about strengthening that in terms of supporting working families and other families.
Yeah, I think we went for years with being one of the lowest ranked states, but since 2007 and moving forward, we're at the top on this program in terms of the payment rates and eligibility standards and some of them. What to do that, we had to create a waiting list. There's no easy answers in this whole, when the need is so big and the resources are limited. The only way we've been able to improve the quality of the program was that at a certain point, when we cannot meet budgetary forecasts, then we shut the program down and put people on a waiting list.
But I think what's worth just sort of noting in that, so even if it's 81% that's supporting employment-related daycare and 19%, I did my math right there, that's supporting licensing and our quality investments in our professional development system, that's a really, that 19% is actually a huge percentage of the resources that go to make those things happen in the state. So they really are very significant investments beyond, those are investments in the entire child care workforce and not just investments in programs and families that are receiving the subsidy. So it's really an investment that impacts
every
huge
family,
amount of families.
yeah, every family who
and in
uses
addition to the specific rules, and we'll touch on this a little bit more later, in addition to the specific rules around how you allocate the resources, as part of this block grant, there is also very specific guidance, or in effect, rules that it provides the state around licensing and monitoring and professional development and other kinds of requirements. So it does provide a framework and guidelines, you know, and at times also things to jump over, you know, that are part of the work that we do.
So that, no, I think that was a great segue into what the plan is and isn't. So the Office of Child Care within the Administration for Children and Families requires the states to create a written plan they submit. So receipt of the funds is dependent on submission of this plan. It's not a budgetary statement, it's all about goals. It's not unlike the documents in some ways that we created today. So it sets very high level goals, and they have very specific things they hope states will do that they can't require them to. So what they do is they put in the plan that you have to tell them how close you are. So they can't. It's the way that the Office of Child Care is trained to continuously improve child care when they really don't have the control that they would like. So it's a very similar conversation to the one we've just had.
But with that being said, I think the CCDF plan, because it really does focus, and these are the high-level goals that are in our current plan, it is an opportunity for us to take a look at the work that we're doing around child care quality improvements and professional developments, and assess, is this the right direction that we are headed? So I think that's part of what this opportunity is over the next couple months in working on the plan. One of the things that we are going to have to be thinking about, though, are some of these new CCDF rules. As Bobby mentioned, stronger focus on child development. In some sense, that's just the feds are saying, we're supporting the work that you're already doing. I think we've already headed in that direction, so I think that's just an affirmation of that work. There are some pretty significant rule changes. I think the most important is that the new rules require that license-exempt providers receive on-site monitoring, health and safety monitoring. So this is a population where we do that already currently with licensed providers, but this will be a whole new population.
Well, actually, this is upping the ante, because for regulated providers, we have only done it every 2 years. So it's and then our new that we just passed is going to be allows for an annual visit. But this is I think pay attention to this. This is really changing a very important way of thinking about home-based care. And what this new requirement is saying is this isn't just between the child and the family, the family and the provider, and that if you receive public funds, you will be monitored. Whether you're regulated or not, you will be monitored. So I don't know, but if you've worked in the field of early care and education, this is a huge change.
It's a big difference. It's a really big difference.
Yes, all of these are big changes. Yeah. The next one, fingerprinting. Oregon has looked at this numerous times and always decided that our criminal background check in Oregon that we did was sufficient, and that we did not think it was worth the price, because there is a substantial cost associated with having to fingerprint, especially in home-based care where it's going to involve more than the caregiver. But anybody who is going to have direct contact with the children and on a regular or on any routine basis. So we've got until 2017 to figure this out, but this one's that's a major change. I mean, things like, where are they going to get fingerprinted? Right. How long is it going to take? I know we're going to hear from programs, but I can't do that because I need to hire this person off the street. And if they have to first go get fingerprinted, how am I going to staff my program? These are profound changes in the way Oregon has done business that I think will hear from people about.
So just to take a quick pause, we have some questions. Do you want to take them now, or do you want to take them at the end?
We have one last slide, so
great.
So maybe just I'll do that, because that just gives us a little bit of the timeline.
Okay, so if you've indicated to me you have a question, if you could just jot it down so you don't lose it, we'll come to questions in just a moment.
So this is just the template for the CCDF plan is just about to be released. We're required to post a draft plan in March, and then have at least 60 days before the posting of the draft plan and a formal public hearing. We're hoping to have an opportunity to bring the draft plan also to this council's child care work group in April, and so that's sort of what's driving the timeline for May or June, bringing this plan back to this council.
Thank you very much. So we do have some questions, and I just want to note for the record, we've had a couple of members who've had to leave. I myself have to leave at 11:30. I'm going to pass the gavel to Dick if that happens. Okay, so Martha.
Okay, so on your new monetary and safety requirements that you're asking, I'm not as familiar with some of this as I probably should be. So how do we do this now, or do we? And what are the feds suggesting? And what kind of monitoring is this going to entail, or do you think might entail?
Well, what we do now, if you are a license exempt provider receiving a subsidy, is a self-report, and that's no longer going to be sufficient. I am not clear. I could read what it says, but I think the answer is a lot's to be worked out. And we have time to do that, but because we've got until 16 to November of 2016. So I think that, and that's why we want to engage you, because these conversations are now going to be ongoing.
And I would, in some sense, the work around these new requirements is a part, but probably a pretty small part of the CCDF plan. But the work around these new requirements is also a longer-term conversation. So I think in some sense what we're doing is actually setting up two conversations. One is more directly about the CCDF plan, and one is this ought to be on your radar because this is going to be something you'll hear more about over the next 2 years.
And then follow up on that. What do they self-report right now? Or I mean, I don't want to.
It's a checklist
just a checklist
on health and safety.
Okay.
What they have and don't have in the house, and whether it's under lock. You know, those kinds of things.
Okay. Thank you.
And they go through criminal background.
Other questions? We have Dick in the queue, and I'm in
Just
queue
to say very briefly, you guys could bring forward the background check and the fingerprinting is in our state. We don't have any uniform ask for that. So if you're a volunteer for ESD, or if you're a or if you're a school district, or if you're a volunteer, period, it's all dictated by liability insurance, and so everyone is saying something different. And it's very expensive. And so if we had, a lot of states have uniform background checks and then a uniform cost also, and then have a central located place. And of course with the technology nowadays, it's quite simple now to, I mean, if I can come in from out of the United States and put my 4 fingers on the customs thing and get, so there's a lot of ways to go, but we're way behind the curve on that. And it's slowing down also people who want to get engaged too.
So I have myself in the queue next. So given to your point, Bobby, the profound nature of some of these changes in how we've historically dealt with childcare in this state, I think, I don't know what the specific plans are for gathering input and public engagement, but I hope that we have more than a public hearing. I hope we have hearings across the state, and it may be that there are all or parts of the draft plan that we want to run by gather input from other council work groups that are in existence, for example, the Equity Subcommittee, just to be sure that we are gathering as much input as we can and to get as many brains as we can harness, putting us in a positive direction on this, because it's going to be significant.
I think right now, anything the council thinks that staff should be providing so that that the council members have, I mean, has some of this sounded like Greek and you'd like more information? You know, that I think we want to get out too.
All right, yeah, so Jim is in the queue, and Krista and Eva. Jim.
Okay, I thought that meant I was last.
No, Jim, then Krista, then Eva, sorry.
So I'm wondering if there's an opportunity here. We've talked today about the vans. At least in my mind, I look at this is really a large number of people who are actually employed in this if you add it up across the state, but they are so completely under the radar of the economic development systems. Is there an opportunity with this fund, either by using it as a pot that we'd ask for a small amount of money from the legislature, or the resources here, which sound pretty committed, to maybe do some pilot projects to help these places that maybe need a van? Is there some opportunity to partner with the economic development systems to help them do something small scale that could be replicated? I'm thinking really small, $4,000 or $5,000 loans sort of thing, that might actually be replicable and produce jobs. They could count them as jobs and get support through the economic development system, or partnering with this fund and economic development to help these small businesses stay in business. And I don't know if the staff would work on that. I'd help if you wanted.
I think that'd be great for us to look into. I don't want to speak to it directly today because what I do know about CCF is it has so many requirements that would be a good thing. But I will work with staff who are closer to those regulations to find out what are the opportunities, and also to find out if any other states have done anything around this.
In the regulated workforce working directly with children, we have 21,000 people. Right. And so then you've got bus drivers and cooks and all kinds of people in addition. It is a substantial workforce that we're talking about.
So Krista in the queue, and then Eva.
So I guess I want to make sure that I'm making an assumption, and I want to make sure that I'm making it correctly. But the Early Head Start Child Care Partnership grants that just have recently come from the federal government, those request and require a coordination of funding that includes both Early Head Start funds and also CCDF funds, right? So it just occurs to me that it would be helpful to us to observe and watch that partnership, because I think
and how that emerges over the next couple of years with the 4 grantees that we know of right now in our state. Because I think this notion of the reauthorization and the increased focus on quality is indicative of future goals that I've heard on federal calls about talking about not being able to see necessarily delineation between the quality of different kinds of childcare or early learning environments for children. And so whatever methodologies are employed using these federal resources around the partnership opportunities, I think they might be helpful for us to be aware of and to learn about as we're thinking about this next iteration of how we're going to use CCDF and think about how it impacts our state and our children.
Eva.
So I kind of wanted to say that we are thinking about some other things that you didn't include on here. The eligibility, 1-year eligibility. Yeah. And then the exit eligibility of, aren't we asking for 250% exit eligibility, which is above what the federal recommendations
Right, and so
are.
here we were just talking about what's in the federal rules. I wasn't talking about some of the other, I mentioned the speaker's bill, so
Right.
there's other context.
But yeah, some of that is in the federal rule too, and
Yeah.
we're actually going
beyond that,
and so hooray for us.
Yeah.
Yeah, I mean, I think that I took that when Bobby said we are actually sort of ahead of it in Oregon. That I took that to be part of what she was referencing.
So I mean, but it does put, and I know Bobby said something, you know, like it makes the money part discussion a little bit tougher, and I think that's why I really wanted to talk about, you know, the recommendations of the floor of 70%.
I'll sell it.
You know, or that's not a recommendation.
it.
That's like we have to do at least 70% to subsidy, right?
Yes, we have to.
But
we do 81%, so it's not an issue.
I know, which I love that we're at almost 81%, and you know, like 9% requirement, and then the rest of this has to fit in somewhere. So we're being asked to stretch dollars, and yeah, it's mind blowing to me. I don't know. I just kind of want to reiterate, like, make sure we're paying people and make sure we're getting access to the families that need it. And
Any other comments, questions? Okay, we have, thank you very much. A lot of time put in on this. There's been no public testimony, so we are adjourned.
Oh, I do have one quick note from Marlene.
Oh.
I am so sorry, but she just texted about it. As you know, in March at our March meeting, we're going to be receiving the equity recommendations, and probably most of that meeting is going to be focused on equity. Marlene's been working with a consultant whose name is Carmen Morgan. As part of their presentation of those recommendations, Carmen's going to do an activity with us as a council, with you as a council, that's designed to help you feel what it feels like to experience disparities, and she wanted to warn you about that now 6 weeks in advance, so that you don't feel surprised, although you may feel uncomfortable, because
You ever been in the car business?
sometimes those can be uncomfortable exercises. So Marlene wanted everybody to have some forewarning on that, and that's all.
Okay, we're adjourned.
Can I make just a quick announcement? We're really
Sure.
lucky
But we
that
are formally
Oregon
adjourned.
is going to get 2 wonderful speakers on our topic are coming February 20th, and the council has received invitations, but I brought flyers. There will be a noon seminar in Corvallis, but it'll be live streamed. And so people all over the state can, Greg Duncan and Sibel Raver are like as good as they get. And they're going to come and talk to our legislature about investments in early childhood. With taking approach of 2 generational approaches, so the parents and the children together.
what days was it, Bobby?
Pardon?
What days was it?
February 20th, and you've received a save the date, I believe, and you're going to get an invitation.
And who sent
But
it
I brought
out?
these for everybody.
Okay, who sent it out?
And this has the live stream, so you could give to anybody the live stream, so that.
Thank you. That's great.
So yeah,
Going,
it's just a
going,
save the date.
gone.
Very cool. You're just